Okay, good morning. Welcome to everybody here in the building and out in TV land. I'm Jenny Glass. I'm the Budget Branch Manager, and we thank you all for joining in for the FY15 Local Health Department Budget Preparation Training. A few things I want to go over. This is mostly for the people in-house. Cell phones, if you will, make sure you've got those on vibrate or silent. If you need to take a call, if you can step out in the hall. Restrooms are out the door here and to your right through the double doors, and right past the elevators on the left is the ladies' restroom. Go on down and go through the double doors on the left, and the men's restroom is right down that hallway on the left. There's snacks, of course, out here in the lobby area, and cafeteria is downstairs, but we'll get to that around lunchtime. We've got a pretty full agenda today. I want to thank Lisa Pollock from Lincoln Trail and Jimmy Cecil from Pike County coming to assist us again this year. We appreciate their help. And something else, want to be sure we stress, typically we do a deadline for your budgets to be submitted 30 days after training, but since allocations have not been sent out yet, we are changing that date to 30 days upon receipt of your allocation. I'm going to say probably the next to the last week of April. I'm not certain. We still don't know about the budget yet. But your budget will not be due until 30 days after you receive your allocation. And I think that's it. And Miss Vicki Towns, she's one of my local health budget analysts. She is going to start with reminders and refreshers.
Good morning. As Jenny said, I'm Vicki Towns. I'm one of the local health budget analysts. There are only two of us now, myself and Melissa Freeman. So as you all know, there's plenty of you all and only two of us. So I'm going to do the reminders and refreshers. As far as the budget templates, the mechanics of the templates haven't really changed a lot. So a lot of this will be very familiar to you all. So I'm going to kind of go through it probably fairly quickly, but you can raise your hand if I'm going too fast. What is new for FY15 on the budget templates? The public health block grant funds must be manually entered into the bud form for the approved programs listed in your budget manual. You will need to determine the amount needed for each program. If you'll recall, that budget line had an automatic spread or a manual spread you could opt for. We've taken out the automatic spread because it was kind of dumping everything into environmental, so now you all will be able to kind of determine and think about what cost centers you wanted to go in. Just make sure when you're doing that that you're not creating a surplus with that block grant monies, okay? Something else different, the HANS Medicaid cost center 853 and 463 revenue and 422 revenue. And then the HANS Federal Home Visiting Services Grant, cost center 760. Those receipts must not exceed the estimated allocation that you received on your MOA and your program folks. Before you've been able to exceed it up to about 10%, now you must not exceed the allocation. The HANS Federal Home Visiting Services Competitive Grant, however, cost center 767, can exceed the estimated allocation, but no more than 10%. When we get to the bud form, the Medicaid match expense, there is a new calculation being used on the plan tab of that template. It has been revised to acknowledge all the changes on the Medicaid match calculation. Some of those from the fiscal benefits of the Affordable Care Act, which is a zero match requirement, and then the different rates that are required for the K-CHIP, breast and cervical cancer, and the family planning programs. Melissa Freeman will, or maybe Lisa, will get to that when they do the bud form template discussion. On the clinic template, we have added a new code, the telehealth facility charge. That is for when you have a patient appear in the clinic and you need to contact a doctor at UK and U of L, you'll be able to get a $25 charge through Medicaid. You won't be able to pay necessarily for that service because they're seeing the doctor through UK and U of L, but you will get some revenues based on that. Okay, if you use that code, it's a facilities charge. So that's new. I believe Dr. White has been talking about that in some of her meetings with you all. Reminders, these haven't really changed. You will not receive any FY15 payments until your budget has been received and approved by DPH and your Board of Health. This includes receipt of your Board of Health minutes noting budget approval to us. LHDs can submit budgets to DPH prior to your board meeting. Sometimes that is beneficial because we can kind of go over it, look to see if there are any ticky-tacky items that need to be corrected and send it back to you. And then that way you've got a clean budget that could be presented to your board and you're not having to make any changes. So you can get those into us before your actual board meetings. Budgets, as Jenny said, are due to DPH no later than 30 days after those estimated allocations have been provided. And please notify your budget analyst when you put your budget on the L drive. We are not mind readers. Some other helpful hints. Reviewing the available program descriptions will help you in determining what expenses can be paid for in different programs. We are working with program staff to update those program descriptions. They are out on the L drive under the folder program descriptions. So we are working with them to get those updated and make sure there is one out there for all your cost centers. Completing the AFM and program staff budget revisions upon notification will assist in timely approval of your budgets. I'll note again, there are only 2 of us and plenty of you all, so the more time we have to look at them, the quicker we can get them turned around to you all. Your health department budget should balance without using the unrestricted reserves. We know that you do, but your local receipts and your public health block grants should be used first, and as little of as your unrestricted should be used for reoccurring expenses. These should generally be used for one-time unexpected expenses and not reoccurring items. That's your savings account. Once your budget has been completed, something to kind of help you, if you'll get your 117 report, a year-to-date, and kind of look and review at your year-to-date numbers and kind of match those up to what you're budgeting for expenses. Your 116 report that has your program information, if you'll kind of go through that and look at your individual cost centers on your budget from your bud form and how everything's rolling up, and kind of peruse that and make sure that it looks somewhat consistent. There are things in there that you know should be in there and that it looks reasonable. That's what AFM, that's what we will do when we get your budgets. And, you know, if something looks out of whack, we'll send you comments back. So if you can kind of go ahead and take a look at that, and if you submit it, provide us any information of why you may have done something that you did. That'll help speed things along in the review. Again, the public health block grant, the reference the budget manual for those appropriate cost centers. And again, when balancing the budget and you're using restricted or any unrestricted reserves, please look at those and kind of look at your current year. Anticipate closeout and what you may need to use for closeout to make sure that those funds are available to be used in your budget. Okay? Does that make sense? Okay, this slide, the budget flow process, this isn't new. When you leave here, you'll take your budget off the L drive and put it on the C drive. You'll complete your budget, and then you'll copy it back to the L drive, and you'll let us know when it's there. The analyst will review, we'll do a first review and send it back any changes that may be of a mechanical nature or something that looks a little out of whack. We're checking allocations, making sure you posted them into the right lines, that sort of thing. You'll make those corrections, send them back to us. We'll review them again and then send it back to you. then we'll send it on to program staff if it's okay. Then program staff will review each cost center that is assigned to them and check for some of the same things that, expenses are being recorded correctly on the lines, that you have expenses in there that are allowable, that sort of thing. If they have any changes, we'll send that back to you all. You make the changes, send it back to us, they'll look at it again, and once all those corrections have been made, we can approve your budget, as long as we have the board minutes. Okay? Here's the color coding on the budget templates. Anything in yellow means you can enter into that cell. There are several cells that are available for DPH use only. If there is a cell that is red, that means there's been something done, that there's a mistake. So take a look at that, see if you can figure it out. If not, you can contact us. Okay, but no red should come through. I think you'll notice sometimes on your clinic templates, if you go to that mandatory tab, that services you have to have, you'll see red in there. All those need to be corrected, and then the red will go away. Here's our list. We've provided a hard copy of the list of each health department and their analyst assignment. Certainly either Melissa or I are available to answer any of your all's question, but if you could kind of coordinate, and if we're assigned to you, call us. It kind of helps with the continuity of being able to help you with problems. Okay? But again, either one of us can answer any of the questions you might have. When should you email us? For all technical programming budget problems, once you have completed your budget and submitted it on the L drive, and once all revisions have been made as requested by program staff and all templates have been resubmitted on the budget on the L drive, and anytime you have a question or need assistance. We do take phone calls, but email is a little bit more helpful because we can handle more of them more quickly. Budget submission, what should be included? We need your board minutes that indicate your board approval of your budget. Your CH-31 for counties that receive money through fiscal county court or city councils. Any special arrangements that you might have made with a program staff should be forwarded to us as well. For example, last year, abstinence was not included on your MOAs, but many of you contacted the program manager and said, I'd like to budget revenue for abstinence, and she would give you the authority to budget a certain amount. Again, email trains are better, because that way you can forward us information. We've got documentation of that approval, so that way we don't have to ask you. And any and all these documents can be scanned and put on the L drive in your FY15 budget folder, but if you do that, please let us know too. Here are the do nots. These have not changed. Again, as I said before, the budget templates, the mechanics of the templates have not changed. They are Excel files, and there's a lot of stuff that is connected. So these do nots are to help us and to help you, i.e., please don't sort any data unless there's a button to provide a sort. Please don't delete or add any rows, because again, that changes your reference for calculations and that sort of thing. Don't hide columns or rows. Please don't copy and paste into templates. And then if you need to clear or information that's in a cell, use the clear contents rather than to delete, okay? And please do not delete formulas. So all of you all have your budget templates out there, so many of you have probably already done this. I think most of you like to copy it from the L drive to your C drive, because apparently the L drive is hard to work in. So here's how to copy from your budget folder to your C drive. Most of you should know how to do this, so I'll go through these pretty quickly. You want to open your L drive and click on the LHD budgets folder. You want to find yours and click on your folder. And then you want to right click, you want to find the Budget 15 folder and right click on the folder. Then you should get this drop down box and you want to click on copy. Then on your C drive, go to your C drive and you want to find a blank area and then select paste. Okay, and that will put the whole folder on your C drive. Okay. Here's a slide on how all of these budget templates are connected and the links that they have. When you get it onto your C drive, you will have to redo the links. So when you go to open up one of the templates, now the screen that you're seeing is an older version of Excel. I know many of you all have upgraded your Windows Office, the main Windows platform. So hopefully you have updated Excel as well. And many of you have Excel 2010. So you won't necessarily see options if you have 2010, but you'll want to click on that. When you get to this enable content will actually show up as a bar on the template. So you want to enable the content and enable editing. Okay? Then you should get a box that will say edit the links. Or you can go under the Data tab and edit the links. So then you'll see a box here. You'll want to make sure that each file is linked to the file on your C drive. You're going to see something that says unknown, and once you change that source, you should see an OK. But you want to make sure that all your templates, your bud form links to all the individual templates on your C drive, and then the individual templates link to your bud form on the C drive. So you click on the file to link the spreadsheet and note that it should be the FY15 folder, and then you'll want to click close. If you have trouble with the linking, just give one of us a call and we can help you. Then to save the template, you click on that little save icon that looks like a little disc back from way back in the 80s and hit continue because again the templates are in an older version of Excel to accommodate those who may still have that older version of Excel. So if you have a newer one, you'll get that continue box and just click on continue and you should be okay. Then once you're done, you'll want to copy the folder back from your C drive to the L drive. So on the L drive, go to the LHD Budgets folder and open it. On your C drive, you want to right-click on the whole Budget 15 folder. Don't open it up, right-click on it. Select Copy. Then go to the L drive and right-click on the LHD folder. Don't open that folder up, because there is a Budget 15 folder in there. You just want to right-click on your name, your health department name. Then you're going to hit paste, and if you've done it right, you will see this box that says yes to all, yes, like it's asking you if you want to replace something. You want to say yes to all because you want to replace the folder that's currently there. If you don't do this right, you'll end up stacking them and we won't know what version to use and we'll have to call you, okay? So then after completing the steps, there should be only one 15 folder on your L drive. So you can go in there and take a look. And if you've got them stacked, let us know. We can help you, but if you do it the right way, it should work out just fine. So on this slide, we've given you some reasons for denials in prior years to kind of help you all check things before you send it to make this go a little smoother. Again, there's only 2 of us and 61 of you all. Your bud form, on your bud form, not budgeting any revenue in the Medicare flu shot, clinic self-pay, insurance, or copay. Not entering square footage for all cost centers with salary and vice versa. Entering numbers of establishments in the environmental template. Not entering mandatory services for the clinic and Rad Lab Path templates, or on the clinic tab, providing a reason why you don't need to enter any services for a certain function, okay? WIC services for the clinic and Rad Lab Path should always be budgeted in the project eligible column. And then on your contracts template, not entering contract ID numbers and not using that correct minor object code. There is a matrix tab on that template to kind of help you all know what services belong at when, or what minor object code should be assigned to what services. Okay? These are split grant information. When you receive your MOA, some of your grants, some of the grants that we send you all do not coincide with the state fiscal year, which is July through June. So therefore, some funding is split within the fiscal year. Some of the examples are EPI and WIC. So you'll see on your MOA and in your R6, you'll see what the dates of the split is. We just bring this to your attention so that you can be mindful when you get into the actual year, knowing when you need to spend those monies. Those monies, if you have something that's July through December and you don't spend that whole $5,000 in the July to December period, you could possibly lose it. It is not automatic that it would roll into the January through June period, because some of those program managers will review their allocations and they can realign amongst the health department. So just be mindful as you're reviewing your MOA and keying in those allocations to make note of any that are split grants. Okay. WIC is also one of those. You will need to be on the L drive in order to get your budget templates. Hopefully by now, if you can't get there, you've already made other arrangements. But if you haven't and you can't get to the L drive, you've never been on it before, you would need to contact local health operations, and they can get you the information and the passwords and security authorization through CDP to get you on the L drive. Questions? Comments? Snide remarks? No? All right.
Everybody's good.
Completes my portion.
Everybody in TV land good?
Oh, I'm sorry.
WIC services on the page for reasons for denials. WIC services for clinic are always project eligible.
There is a project eligible column on your clinic template. When you key in your estimated amount of services, they should be keyed, if you don't use the annualized function, should be keyed into that column. Okay.
Any other questions?
Anything else?
TV land?
All right.
Okay.
Moving on.
Thank you, Vicki. Okay, next up, we're going to talk about some program staff changes and different information about the programs. We have for 774 Child Fatality Review and MCH Coordinator 766, Anita Martell is going to come up and address some changes on that. The Child Fatality Review, that's going to be something new beginning July 1. So, welcome, Anita.
Thank you for ain't gonna be much time. I'll draw it. Hi, I'm Anita Martell. I'm the new kid on the block here. CFR now has its own cost center that was effective last week. It finally went through. It is cost center 774. And you have a budget now for CFR as well. That would include travel to meetings, It would include supplementing salary. Of course, $800 per county is not going to do a whole lot for salaries, but it's something, and it's a start. So give us time, give me time, and we'll work on getting more. The main thing that we want you to focus on with CFR is the data. We need to get that data into Catalyst. CDC is watching us as a state, and if we can get some good numbers for them, we might be able to model something and bring the money back here. That's not a promise, but it's something that we're hopeful for. The other program, MCH Coordinators, is Cost Center 766. You've had a budget with that for a couple of years now. It's going to be continuing again next year. As my previous colleague stated, if you don't expense your money before the end of the contract year, chances are you're going to lose it. Same thing. So you need to expense those dollars. One of the things that we're doing with MCH in the coming year for 2015 is we're loosening some of the restrictions on expensing. We're going to allow more in the way of travel expense. We're looking at increasing the number of packages offered, which means you'll have more choices. And you might be able to take a package for half the year and a different package for the other half of the year, thereby scheduling how you approach the information within your community, with the school system or something like that. The opening of a new possible community partner, things like that you can look at. It's opening a lot more on the horizon for MCH coordinators and the program. So, to reiterate, please expend your dollars. We have a little bit of leeway this year because it is federal dollars that we'll be able to expense those out a little bit further. But if you know that your county has a lot of money sitting there in the MCH budget, get her done. Please. Thank you. Are there any questions?
Will their allocations be, like we just showed, the split allocations, will they have so much they have to spend in this period of time?
Yes.
And so much in this period. So that's, again, important that you pay attention to that allocation if it's going to be set up with, July, August, September, and then you get another allocation. Keep in mind that if it's got a time frame on your allocation, you have to get that money spent by that last date on that allocation.
We're doing MCH every 6 months, a 6-month split, but I personally will be looking at every 3 months, every quarter. And by the 6 month, by the half year, if I still have funds left in your budget for the first quarter, we're going to be talking. So we need you to expend those funds if at all possible. If you're having problems expensing the funds, call me and let me know, and we'll work it out. We'll work through it. Okay, let's try this with the money. But don't give up that money. It's too hard to come by.
If they don't make arrangements or contact you to let you know, hey, I'm having trouble getting this money spent, and give me some more ideas of how I can get it spent, will you then take your review, and then could that money be lifted from that health department and
Yes.
do the realignment so they could
Yes.
truly lose it?
Yes, we have a trusty thing called modifications here, and that's what we would be doing if you can't expend the funds or justify not expending the funds. Say at the end of the year, you know that a certain provider is going to have a discount on some materials that you want, say one of the packages. Then you can say, okay, Anita, I'm not expensing them during the first, second, third quarter. I'm waiting until the fourth quarter because we want to purchase this, and in order to get enough of it, we need to have this discount. Well, then I'm going to make a note on your file, on your contract file, that this is what's going on. And when my powers that be ask me why the money is still there, I can say, because this is what's going to happen here.
What is your contact information?
My contact information is area code 502-564-2154, extension 4418. My email address is Anita, ANITA, Martel, MARTEL, @ky.gov. Any other questions?
Is the money on our fiscal year? Is it the health or is it?
Yes. Well, it is and it's not. The money is from a pool of federal funds. So there's a little bit of leeway there that we're using this year because so many of the local health departments have not expended their budgets. And we're hoping to motivate that, to change that. But on future years, yeah, it's going to be according to our fiscal year.
So when you say packages that you're going to be offering, they're going to be over and above what's already previously?
That's correct.
When is that coming out?
For 2015,
So,
very shortly,
okay.
very, very shortly. You'll have, we're working on them now. I think we're looking at a possible release at the beginning of May because what we're doing has to be put into the AR by May 7th. Anything else? Well, thank you for coming.
Thank you, Anita.
You're welcome.
Okay, I just have two reminders that Gary Faulkner asked me to present. It's on cost center 772, the health benefit exchange. And basically, he just wanted me to reiterate you have till June 30 to get those funds spent. And basically, like Anita was saying, if you look like you're having trouble getting those monies spent, you can contact Jeff Brock. Someone in TV land needs to mute their mic. Thank you. Basically, you need to get those monies spent, and if you can't, then you really need to get in touch with Jeff Brock and see what kind of a plan we can get in place to assist in getting that money spent. He also said that not to forget brochures, any of those kinds of materials, marketing materials, that those are allowable purchases as well. So you could look into trying to get some of your money expended through that avenue. But again, it needs to be spent by June 30. If you're having any trouble with that, then contact Jeff Brock. 773, that's the super utilization cost center. And that was basically set up for your all's purposes. It's not a reimbursement. We don't pay from that cost center. That was strictly for you all to be able to track your costs related to super utilization. Let's see. That's really all. He just wanted me to reiterate that to make sure everyone was aware that 773 was out there and that it is not a reimbursement cost center. So that's all I have on that. Melissa, do you have anything else? Because we're a bit ahead of schedule, so we need to fill some time. Vicki, do you have anything? Okay, Melissa's going to come up and talk about something surprising, I'm sure.
figured right now we would talk about the program description folder that's on the L drive. We started that last year where we had all of the program staff for every cost center do a program description for each program. And we put it out on the L drive. It's in the LHD budget folder. And right now, you're just going to see an FY14 folder in there. Hopefully, in the next week, we will have all the new ones for FY15 put out there. Program staff is currently working on those. So we will have a new FY15 folder. We're going to leave 14 out there. So if you need to refer to it, you can, because the year's not over with. And put the new ones, updated ones for FY15 for the program description. I know throughout the year, people have questions about what can I do in this program, and that's the first place you really need to go look, is on the L drive in that folder. It has the program staff contact name and telephone number, has allowable, and definitely if there's unallowable expenditures that they cannot pay for, those will be listed in there, and what function codes you can use with that program. So, anybody have any questions about that? As always, you can contact us, and we will help you as best possible with those programs and send you in the right direction to that program staff. But we tried to make it easier for you all to have some information at your fingertips. So we are trying to help as much as possible. Questions about that part? Hold on just a minute.
Okay, does anybody have any more questions or just anything, not even necessarily budget related, but that you want to talk about, anything like that? We're just trying to fill a little bit of time because we've got ITV folks that have changed their schedules to be here at a certain time, so I'm trying not to interrupt their plan. So, anything else? Lisa, you or Jim have anything you want to talk about? Not yet? Okay. Well, we'll go ahead then and we'll take a break, come back at 5 till 10. We'll get started again. And TV Land, if you can make arrangements for our change in the schedule, I'd appreciate it. I apologize. Okay, we're going to take a break. Okay, we'll be starting again here in just a few minutes as soon as everybody gets in. Okay, looks like everybody's back from break here in the building. TV land folks, I hope you've joined us. We're going to pick back up now. Jimmy Cecil from Pike County is going to cover the environmental template, and he's on his way up front now.
Good morning. I'm Jim Cecil. I am the Finance Administrator with Pike County Health Department, and I have been with Pike County Health Department about 11 and a half years, and so I've been through several of these budget processes, and each year it's gotten a little bit tougher with less funding, and we just have had a lot of difficulty, especially the last 4 or 5 years. And so first template I'm going to go over this morning is the environmental template. After I get through with the environmental template, Lisa is going to take care of doing the contracts, and then I'll come back and take care of the clinic and rad lab tab, and then we'll break for lunch, and then we'll go ahead and proceed in the afternoon. So if anybody has any questions throughout, just stop me. I know I'm expecting that there's a lot of new people out there, so please ask questions. This is where you're going to learn. If you don't feel comfortable necessarily buzzing in on ITV, you can always send an email to Vicki or to Melissa or to Jenny. But, you know, we're here to help. We want everybody to be comfortable doing this, and especially if you're new, this may feel a little overwhelming, but, you know, just take your time and go through it, and somebody's here to help you. Okay, here. Hey, Melissa, could you open up the template for me? In just a second, we're getting ready to open the template up. All right, whenever you open up the template, the first thing you want to do is make sure you enable the content. Okay. Now, for the environmental, first thing I'm going to do is go over the tabs down at the bottom, and there's only a couple of them on this template. The first one is the input environmental, and this is where you're going to enter actual information from your environmental section. And the second tab it's got the exclamation point and refresh. And this is actually the data mart information that was available. Melissa, is this up through the end of March, or is it through February? Okay, this information is through the first 8 months, and most of it, all of this should be preloaded on each of your templates. So each of you are going to have 8 months worth of information already loaded into your environmental template. And this information is going to feed over into the main template where you actually enter the information. So just to give you an idea of what each of those tabs are for, and I'm just going to go back on over to the Input Environmental tab. Now, the way that I do this each year, I'm sorry?
Excuse me, are we gonna be able to see the template on the screen? This is Louisville,
can't-
by the way.
All right, you can't see it?
No, we can see a shot of the room, and the screen is across the room, but we can't see it on our screen.
Okay, well, hold on just a second here.
Now, can you see it?
Yes,
Can you see
thank
it?
you.
Okay.
You're welcome.
And if anybody has any problems like that, just speak up, because we can see it in our room here, but we don't know what you're necessarily seeing out there in TV land. Okay. Now, on the Input Environmental tab, the first thing that I do is that I take last year's information as far as our establishments, and I take it over to our environmental staff, and I ask them to go over this, because you're going to have some changes, but from year to year, there's very few changes. You're going to have some restaurants that open and close, and so basically I just ask for them to update this information. You know, if there was a net difference of 5 or 10 one way or the other, they're going to provide me with that information, and I need this information so that I can fill the environmental template out. Okay, so I give that list to the environmentalists, they provide it back to me, and then I take each of the establishments that they provide and enter them in onto the template. And what you'll need to do is for each section, and there's food, or there's 500 cost center, there's public facilities, there's on-site sewage, and there's another one, but they're included in the 500, 520, 540, and 560 cost centers. So I've given this list to them, they provide it back to me, and then I just go down, and for each of the establishment totals, I enter them in under the total establishments or complaints. And you're only going to enter in the yellow boxes. The white boxes already have some formulas inside of them, so you don't want to really mess with anything on that. But where you're going to enter in is in the yellow boxes. So if they give me that I had 25, let me see what this is for. Restricted food concessions, we might have had 25, and I'm just going to make these numbers up so that it'll go ahead and fill in the template. And then I'm just going to continue to scroll down and enter in based on what information they have provided me. So I'm going to fill a few of them out into the 500 cost center. Let's see here. And then I'm going to scroll down, and I'm going to go ahead and enter some into each of the sections just so that you can see what it looks like. In the 520, for the hotels and motels, I'm going to enter some information in. Let's see, 200. Public buildings and recreational. Again, this is not necessarily correct information, but just for purposes so that you can see what's going on. We want to make sure there's enough establishments in each section so that you can see how it's going to populate the financial information that it's tied to over on the BUD form. So I'm going to go ahead and scroll down a few of these and make sure that we've got some in each section. Right here.
So everyone's following what Jimmy's doing.
So everybody understands why I'm doing it. This is not actual information. This is just for informational purposes so that you can see how the templates work. So then I'm going to scroll down to the 540 cost center. Let's see here. Just enter some in here. Okay, and then down to the on-site sewage. 560. And for the on-site sewage, there's going to be little boxes pop up. It's there to help you understand what to enter in. So when you put your cursor over top of it, the box will pop up. And in this specific one, it's asking for the number of permits written. I'm going to click in there, and I'm just going to, again, estimate 325, because I'm not sure exactly what that number is. Let's see here. Okay. Also this year, if for any of you that do radon, all the radon has been put into the 591 cost center, right, Melissa? So you shouldn't have any services in the 580 cost center. If you do, you need to move those services into the 591, because all the radon is going to be included only in the 591.
Yeah, it's feeding in by the reporting area and the service and the activity code. So it's already pulling in what you've done for radon so far this year.
Right, so if you had any services during the current year that were coded to the 580 cost center, they're going to pop up in the data mart, but you got to make sure you don't include any of those services in, because everything is now going to just be tracked in the 591 cost center.
It should all, the services should already be coded into the 591.
Okay. All right, now that I've went through each section and entered some services for each section, I'm going to go back, and then I'm going to compare it to, let me go to the top here. The column in green is the actual fiscal year-to-date services that have been pulled in by the data mart. So, even though I entered 25 as the total establishments in the first section for restricted food concessions, the data mart's showing that we actually done one regular inspection this year. What it's doing is it's taking the 25 that my environmental staff has reported, and it's projecting out. I think they have to be inspected twice per year or 2 times, and it's taking that 25 total establishments and multiplying it by 2. It's coming up that I should have 50 services in specifically for regular inspections for restricted food concessions. And each section, as you go down through there, as you enter this information, there are certain environmental requirements that require. I think restaurants have to be inspected twice, right, Sam? Twice per year. So it's going to automatically calculate this information for you. And that's why it's important to make sure that you get this information from your environmental staff, and that way you know how many services are required for each restaurant inspection for each of those sections. And each section has some of these automatic calculations in it. Now, another thing up at the top, it also has the follow-up inspections. Now, the statewide percentage is 20%. I just basically leave it at this. If you have a county in which your follow-up inspection is higher, you can increase this up to 25 or 30%. I'm just going to recommend that you leave it at 20%, because that's the statewide average. And then also the complaint percentage. This is the statewide average, and again, your local health department can make the change, but the complaint percentage is 10%, and these percentages included in there, they calculate other parts of each of the environmental section down inside as you go down in there. So I'm going to go ahead and just go on down and do a couple of them. Let's see here where I put some. Let's see here. And another thing to keep in mind is that this is only 8 months worth of information. Now, I'm going to tell you the way that I do my budget. In April every year in Pikeville, we have Hillbilly Days. This is not going to be included in our totals this year because it's not happened yet. So I want that information included, even though the environmental staff will give me how many vendors that we're expecting to have to inspect. And I think they have to inspect them almost every day while they're in town 2 or 3 times. They're in town 2 to 3 days, so they have to inspect them each day. But I want a full year's worth of information. So what I do is that I look at 12 months worth of actual information. And in prior years, what I would do is I take the prior year data mart and I would combine it with the current year data mart, and I would have more information that would give me a full year's worth of information so that I can actually have a little bit more reliable information as far as entering in on my templates. I mean, I want to know, because we have activities in environmental that go on during the summertime that are not necessarily going to be included in the data mart information because it just goes back to July 1st. So you're going to have a lot of activities that happen between the end of February and the 1st of July that are not going to be included in the data mart totals. So for me, I want to look at all that information. Now, I'm not sure if it's true for where you're at, but we are noticing a decrease in homes being built. So that's going to affect our on-site sewage. We just got some things going on that are going to play into this. And when I look at my 12 months worth of information, that may not necessarily include that in there, but you can make adjustments as you go forward. There's certain areas in which I don't know if there's any homes being built at all. And if you have information that pops in, you may want to adjust that downward to reflect actually what's going on. But I mean, it's important. I like looking at 12 months. It kind of gives me a full year's worth of information to kind of smooth things out. Because if you just got 8 months worth of information, there's going to be some data missing in which you need to actually get the template filled out. So you got to keep in mind that as well. And these are not annualized numbers. These are actual numbers that from year to date, from the 1st of July through the end of February. But the temporary food service information, I put 30 in there. Now, on the actual data mart, it's showing 46. So what you need to do then is anywhere there's a yellow cell, you need to go in and actually enter the information that you think is the correct information. So I can go ahead and just type 46 in because that's what the data mart has on it year to date. If I don't think that's a reliable number, and I've got 30 establishments in there, and I think that number that's in the data mart's not high enough, because I'm certain it's not, then I can go in and adjust that number up to what I think that it should be. When I enter that number in, the follow-up inspection percentage that is listed at the top at 20%, it'll automatically calculate how many follow-up inspections that is expected to be done on that 60 regular inspections that's entered into the template. And then the complaint is also that percentage up at the top, that 10%. It's taking 10% of those 60 actual regular inspections that were entered, and it's saying that based on the statewide average, the complaint is 10%. It's going to automatically calculate that you expect a 10%, which is 6 complaints. Now, this information, as you can see, there's not any data mart information in there because that we haven't had any of those services that have happened year to date. So I'm going to go through each of the sections and just kind of, you need to go through every single one of the various sections. Like for food, you need to go through every single one of these. And anything that has some information in the data mart, you really need to look at this and see if it's in the right place, because sometimes stuff gets miscoded. You may have one complaint in one section and there's no services other than that complaint. That just might have been miscoded, so you may need to just go ahead and leave that blank or zero it out. But anywhere that you have the formulas already included, just don't even touch those. You may need to just go up and adjust your establishment numbers. So, I mean, anybody have any questions so far? Okay. But I'm going to go ahead and through a few sections. For retail food establishments, I'm going to go ahead and stop there. I've got 50 entered. According to the data mart, I've had 114 regular inspections this year. Based on the amount of establishments I've entered in there, it's showing, and this is how much is going to be included and budgeted, it's showing that I should have 100 regular inspections. So I may need to go back and look to make sure that the number of establishments is correct in there. I may not have the right number of establishments or something's going on there to cause that number to be off. But again, you need to look through each section and make sure that this is realistic information. So then the environmental have their own codes, and each of those codes, they have the 01s up to 13s, and each that represents a specific activity that they do in their section. So for retail food and establishments, I'm showing that we have 12 other, and if I think that's a reliable number, I'm going to go ahead and type 12 in there and include it on the template. Then for field activity, it's got 13 in there. I'm going to go ahead and enter 13 because I think that's a reliable number. If that doesn't feel like a reliable number, I'm going to adjust it. And again, with my information, I'm going to have 12 months worth of services. So when my 12 months worth of services are in there, I'm just going to go ahead and transfer that information over, because it gives me, instead of me trying to have to forecast how much the total is based off of February's information, I'm just going ahead and have got 12 months worth, and so I'm just going to plug those numbers in. And that makes it easier for me. Okay. So let's see here. Okay, here's the food handlers. We have classes that we've got in environmentalists that teaches the food handlers, I think, twice a month, and we have food managers once a month or once every 2 months. This information, again, is recorded, so you need to go ahead and include that into how many, well, this should equal the number of persons attending the training. So when you click in that cell, year to date we've had 94. So we got to come up with a reliable number that makes sense. So I'm going to go ahead and type in 120 in there, because that just makes more sense. Again, if you got 12 months worth of information, you can look back and see. For the food handlers, this should equal the number of classes or educational activities performed. Well, there's 19 showing up. I think, again, I can't remember if we do 1 a month or 2 a month or how it works, but I think we're going to have 24. Again, you'll have this information. You can get more information from your environmental staff. They're going to know what this stuff is more so than I'm a financial person. I don't necessarily understand what each of those codes mean, but they can translate it into me to where it makes sense for me. So I'm going to go ahead and enter that information, and I'm going to scroll down to do a couple more of them in some of the other areas. Let's see here. And it's all going to basically work the same way. For hotels and motels, the data mart's showing 2. I'll probably enter that number in wrong. I know we've got motels and hotels in Pike County. I don't know how many, but let's say there's 25. And then maybe they've just not got back to the inspections yet. So, but once you enter the total number of establishments for hotels and motels, it's going to automatically calculate how many should be done for the year. I think they have to be inspected once per year, so it automatically calculates that, and then it automatically calculates the follow-up inspection, like we have said earlier, based upon the percentage up at the top, which was 20%. And then complaints, again, a lot of this stuff is calculated. When those cells are populated, you just go ahead and leave those alone. You've got to make sure that the establishments are correct. Looking at field activity for hotels and motels, we've had 1. I'm going to go ahead and enter 1 for that. Anywhere that you have a number in the green, you really need to take a look at it and see if it's a reliable number. If it is, go ahead and enter something in there. If you don't think that's a reliable number, then you can just leave it blank or put a 0 in there, and it has the same effect on it. So I'm going to go ahead and scroll down and just enter a little bit into the 540 cost center, which is general sanitation. All right, here. All right, for nuisance control, I entered 250 for nuisance control. Again, that's just an estimate. According to the data mart, we've got information in here. And again, if you'll scroll over to any one of the boxes, it'll have a little comment in it and say the number of complaint inspections made not recorded in another program area. Some complaints get recorded in other areas. You just got to make sure this is a nuisance, and I'm not exactly saying what exactly is a nuisance.
It's basically as any complaint on anything.
Other than.
But it really does, in this category, it really doesn't relate to food.
Okay.
Or a hotel, it may be weeds, grass.
So like for nuisance control, this is where everything else falls that don't fit in a specific category. So for year to date, we've got 10 inspections, so I'm going to enter 10, 12 complaints. Looks like we've had 7 field activities and 120 office activities. And the reason I'm going to go ahead and enter this stuff is I want you all to take a look at this and get a feel for how. You've got to make sure that you look at each of these sections, because every service that's entered, it calculates over into standard hours, and I'll get to that in just a minute, because each of the activities is given a weight, and the inspections are given a certain amount of time that it should take the environmental to do them. And then the complaints, each of these activities are given a weight, and let me scroll here and just kind of show you what I'm talking about. So like for those 10 inspections for nuisance control, a standard hour of 1.5 is given to take care of it. And this basically takes into account the amount of time it takes for the environmentalists to go out, drive out there to where the location's at, take care of it, the amount of time they're out there actually on the site, and whatever solution that they have or reporting that they have to do. It's saying that it should take about an hour and a half of their time. So for each of those services that are entered, it's given a standard weight. Well, my environmentalists sometimes complain that we're in a big county, so they should be given more time to take care of some of this stuff. So it's a standard hour. It's not concrete. It's not everybody across the state. It may take a little bit longer. Some of the bigger cities, it may not take as long to get to some of the locations, but this is just the average for the entire state. And each activity that's entered, it gets some type of weight. And there's a thing at the bottom, and I'll show you that when I kind of scroll down. But it gives you an idea of how many standard hours, which you then can divide it by an amount of hours that are needed for each environmentalist. It gives you an idea of how many environmentalists you should have on staff. So that's very important to make sure that they get credit for every single one of the activities that they do. And down in the on-site sewage, Again, I entered 325. That's the number of permits written. Current year to date, we've had 106 regular inspections completed. If, again, you've got to look at this and make sure it's a reliable number. I'm just going to go ahead and say that out of that 325, we might end up doing 250 regular inspections. The follow-up inspections, this one's not calculated, so you need to go ahead and enter, make sure that you're enter any information that you see in green, you need to come over and enter something in yellow, or just leave it blank if it's something not reliable. So I'm going to go ahead and fill out this section. I'm just going to pull the information over. Now, also for the on-site sewage, on the actual BUD form, there's going to be a calculation because there's a charge, there's a fee for going out and taking care of the, first there's a fee for the permit fee, and then there's also a fee for the actual evaluation, site evaluation. So whatever it is that your health department charges for that permit fee, you need to enter it in here. It will calculate over into revenue over onto your BUD form. Question? Oh, okay. So if your fee is $250, enter that in there, and it's going to calculate your revenue that you expect to generate off of that, that charge. And then for the actual site evaluation, you also need to enter it. I don't know what necessarily, our fees are real low. So just make sure it's a reliable amount that you put in there. If you have a district, get the average that is charged at each of the health departments and enter it in there. And also, if you are in a district, get the average for the actual site evaluation. And that's going to translate into, in this example, $82,700 in fees that we could potentially generate for the services that they're going to provide for on-site. This number will then also be linked over onto your BUD form, and it'll show up as a revenue in your on-site sewage cost center. Now, my understanding is, and Sam, correct me if I'm wrong, your on-site sewage is supposed to be self-supporting. So if your fee is not high enough to support your activities, you may need to look and talk with your board about this to make sure that your fees are set to where it pays for itself.
The 680 part of on-site sewage.
Right.
The 685 part of the sewage program is not.
Right.
It's only the one category.
Right. Yeah, the one Sam's saying the one category of the on-site sewage needs to pay for itself, which is the 680 reporting area. You have private sewage in the 685. This on-site fee is just supposed to take care of the 680 activities, which is the on-site. Does anybody have any questions about that? Yes.
Jim, also they need to consider that when you put in your rates, like for instance, our rate is $300 for both.
Mm-hmm.
But when we go over and look at the on-site plus the site evaluation follow-up, we not necessarily collect the total $300 if it's a follow-up. You may only get partial cost of that back. So you got to make sure that you don't assume that you're going to get exacto
Right.
300 or the 200. He has an example. You may only get 150 of that. So you got to make sure you've got enough to cover that you've not overestimated what you already have.
Right. Did everybody hear what Lisa said? I'm going
TV land, did everyone hear what Lisa said?
Okay. I guess we're not hearing any responses. So.
No, we did not hear what she said. If you could repeat that, please. We had to turn the mute button off.
Okay. Lisa's going to come up and explain that again, what she said.
Thank you.
You're good.
Like Jim, I am not an environmentalist, I am a financial person. But looking at the on-site sewage, you have your site of soil evaluation and then you have your follow-up. And for Lincoln Trail, we charge $300 for both. However, on a follow-up, you may or not charge that full amount. You may only charge $150. It just depends on what's going on. So you have to make sure that you've not claimed that you're going to do 100, but you technically only did 95 of them, that you collected 300, but that 5 you only got 150 because then you've already shortchanged your money. So you have to make sure that you kind of factor that in, that you're not going to get a full 300 in most cases on a follow-up, but you may or may not, just depends. And we've had that situation in the past at Lincoln Trail, but of course, we've been very fortunate the last 3 years. We have ended, we have not had to use local tax dollars. We have been able to fund that program.
Did that answer your question, or did everybody hear that? Okay. I'm going to assume everybody did.
Yes, we did. Thank you.
All right. No problem. Okay, I want to continue on. Again, this year in the radon, there's no services entered in the 580 cost center. If you see any of the data mart services popping up, you may want to make sure that they're moved down to the 591 cost center, because this is where all the radon is going to be tracked this year. And in our example, we've had 2 office activities. I want to include that in there. And also, I put 125, but we can reduce that down to a more reliable number, and let's say we've had 10. Again, you just want to make sure that this information is as reliable as you possibly can get it, because it's very important, because it tells you, based on the standard hours, how many environmentalists that you actually need. And down at the bottom, as I scroll down, let's see here, there are other environmental activities too: streams and lakes, public water safety, water transport vehicles. As you can see, there's several others that fall into 590. And I think for the most part, these are just those other environmental activities in which they fall out of the main environmental activities that we do. So you could, let's see, we've got a couple of them in here for us. I'm not for certain exactly what these. This is kind of like the other category, and they fall into this when they don't have a specific environmental activity to code to. So we've had 1 field activity and other environmental, and 6 in office activity. I've went ahead and entered that. Actually, what I'm going to do on I'm just going to zero them out. I'm not going to include anything in those, because it's just something that fell into a category outside of. And the reason I'm not going to include anything on this is because we don't budget any actual hours or expenditures in the 590 cost center. We just basically have those other cost centers in which everything falls. Now, down at the bottom, for all of the activities that have been entered, it's going to give you the total standard hours. Now, it's calculated out everything that I've entered, which I've not entered a whole lot. You need to really make sure you go over the thing thoroughly and in its entirety. It's going to calculate out what the standard hours are for all your environmental activities. In this instance, we've got 2,410 standard hours. Now, to find out how many environmental staff you should have, you can take that number and divide it by 1,250. That's what has always had been in the past prior to including office activity. If you feel like all the office activity has been included and that all of your environmentalists are turning in their paperwork, especially for their office activity, you can actually up that to up to 1,653 if you feel like all the information is correct. So you divide that number by 1,250 to 1,653, just depending on what you feel is a reliable number. It'll give you how many environmental staff that you actually have or actually need based on their actual activities. Sam, you got anything to say? Does that sound about right? Yeah. Okay. All right. All right.
Go ahead.
Okay. So again, this is for management purposes. It gives you an idea of the actual amount of staff. If you've got staff sitting around and it doesn't seem like they've got enough to do, and that's possible with the downturn in the economy when we've got less homes being built, this will give you an idea of how many actual environmental staff that you need in your health department. It's not a sure-all. I mean, it's not like in concrete. This is not exactly, but it gives you a pretty good idea of where it's at. And you can actually go in prior years and compare to see if this number's went up or down. And it'll give you an idea. Look, I've got too much office activity going on. We don't have enough actual inspections going on. We need to figure out what's going on over in our environmental section. Or it may even tell you that you don't have enough environmental staff. We've had an upturn in the economy in certain locations, and this number shows that we've got 2 environmentalists, but we actually have enough activities for 3. So, I mean, it's more of a management tool to help you see. Everything's very important now to make sure we got the right amount of staffing because of all of our dollars. We're losing all of our dollars. And, of course, retirement keeps going up. And so we got all these extra expenditures, less dollars, so we have to really be better managers of our personnel, especially because personnel is the biggest part of our budgets. One final thing, and it's not showing up. I'm going to see if I can, let me see here. Melissa, can you open the bud form for me?
Go to that, where it's yellow, that folder right there.
Okay.
West? No.
Nope.
It should. Hold on.
Okay. And what I want to show you is that when you open the bud, I
Somebody have
But Melissa's going to open up the bud form, and the environmental template is linked over to the bud form, and it's going to pull your actual expenditures that have been entered.
You have to enter some.
Okay. Oh, there might be something on there.
Yeah, probably not for environmental, because we haven't done salary yet.
Okay. Fence is in there to show you how that it populates the fields over on the environmental template. So I know we're going to have travel for each of the sections, so I'm going to just enter like $2,000 worth of travel for each one of them. Okay, where I've entered those expenditures in, when I go back over to the environmental template, it's now going to populate each of the sections with some funds. Let's see here. Like, I put $2,000 in travel for on-site sewage, and it's going to pop up that $2,000 is now being pulled over from the bud form. If any of these boxes pop up, let me see here. I can't remember exactly what the colors are, but if something pops up, what's the color? If it pops up in red, then there's an error somewhere, and you need to go back and look at each of those sections. Because what's happening is it's pulling expenditures over, and you may not have any services in it. And that's why I tried to enter services in each section so that it would at least populate it and not give me that error. I guess I should have left one blank. In fact, I can blank one out here.
It could be red because of rounding too, so if it's close, then it's not a problem.
Right, there's an example. I went ahead and cleared out all the actual activities, and it's popping up in red. And it's saying there's an error. You've got expenditures on your bud form, and it's pulling it over, but we don't have any services entered on the environmental template, so something's not matching. So you just need to go back and make sure. If you get this red error in any one of the sections, you just need to go back and make sure everything, there's something in there to match the expenditures. Do we have any questions? Have I left anything out? Okay. Okay, if we don't have any questions, Lisa is, okay.
I'm
No.
Edie from Old County Health Department, and I moved.
Okay, all right, great.
Very new. I just wanted to verify, sometimes you would enter information on column L in the yellow box,
Okay.
and then the formulas in there would then just, put numbers in under column F, under the yellow boxes.
Right, yes.
And sometimes you would enter information under column F.
Okay.
So my ultimate question is, should that total equal what's in column L?
In some instances, it will, because to give you an example, like the restaurant inspections. Like if I enter 10 in there, each restaurant is required to be inspected twice per year. So it's automatically going to say 10 times 2, so there'll be 20 total services that should be done during the year. Some of them will only require one. I think the mobile home parks only required one. So if I enter 10 in there, it's only going to calculate, and it's going to show up as 10. Those are in the white cells, they're automatically going to calculate. So anything in the yellow cells you can enter in, so you may need to adjust that. But based on the environmental regulations and requirements, it's going to automatically populate those fields based on what's anticipated that needs to be done.
Okay.
Does that answer your question? Okay.
The number of services that goes in there, you cannot do less than that. You can add and say, well, I want to do 3 inspections rather than 2, but you cannot say I'm going to do 1 inspection. You have to do
Right.
the minimum.
It gives you the minimum that is required to be completed for each of those environmental activities.
So what you're entering under column L?
The, column L is actually like the establishments, like
It's
how many restaurants.
Oh, okay.
Right.
Okay.
F is going to calculate it, and there's some sections that are yellow that you can update the cells. But most of the ones that are required, they're going to go ahead and automatically calculate what is the minimum requirement to do that. Okay?
Environmental 40 report will help you out as well.
Yeah, the environmental 40 report, I think that's, the environmentals have to keep up with that. It keeps up with all their activities throughout the year. So, okay, if there's no questions, then Lisa will be up here to take care of going over the contracts template.
Hi, my name is Lisa, and I'm from Lincoln Trail District Health Department, and we're going to talk about contracts. This is the Excel spreadsheet, not the Microsoft Word. The training for actually the detail that when you write up a contract with a vendor, that training is actually on April 23rd. So this is the Excel component, but you kind of have to have your contracts in place or know who you're going to use vendor-wise on the Word template to have some of those amounts that you've negotiated with those vendors before you can really fill out your Excel spreadsheet. So like I said, once again, that training will be on April the 23rd. That will go in the detail, the bulk of the written language that is required in those contracts. But once you have set your contracts or negotiated your rates and you know kind of what you're going to be dealing with for fiscal year 15, you can pull up the Excel spreadsheet that is in your budget templates. And of course, as always, we would need to enable. And as you can see at the bottom, we have 4 tabs. We have the input contract tab, the contract summary tab, the table, and then the mandatory minor object code. Now, some of those that have done budgets in years past know that they can go pull their template from a previous year and just copy and paste the information. Be very, very careful, because if you've not done it before and you're just using the work from last year, whoever completed your budget, there might be some errors, so you need to make sure you're very careful with that. First thing you'll notice is we have an ID sort, a contractor sort, and a CC or cost center sort. Those can be utilized at any time once you have your data entered. And that's just basically after you finish that you can pull up your detail by ID, the contractor to see, because you may have multiple contracts with the same vendor or same doctor's office for doing different or multiple services. And then, of course, cost center sort, if you want to put all your contracts in family planning, your 802, or if you want to put all your breast and cervical 813s together, or even your home health. If you have home health at your agency, you would include those contracts on here as well. You will not include the contract for your audit. It does not go on this template. That will be put on your BUD form, which that will be discussed later. First thing, of course, you'll need to do is establish your contract ID. If it is a contract that you've had in place prior year, you can use that same ID. If not, you will have to contact state to get a 5-digit number. And most of them start with whatever the minor object. So for instance, we'll go with the 202. And then the last 3 numbers are somewhat of a generic, whatever is set by that department up here. Then you would put your contractor's name that you're actually having the contract. So we're going to use Dr. Sport today. Then we need to know what cost center, the services that they are supplying. In this instance, I'm going to use 802, which is the family planning. You'll notice the next column, column H, is blank, and it's just a white. And of course, the other columns are in yellow. As you enter detail in the yellow cells, those columns that are populated with the white background will soon be populated with detail. So when I put my minor object in of 202, you will see that it tells me that that service is in family planning, which is dictated by the 802 that is in cell F, and that it is going to be services for OBGYN, which is denoted by the minor object of 202. Then you'll put in your total contract amount. As you see, when I put an amount in the column M on that particular row, row 9, it goes ahead and adds that to M5, that cell, because it's going to give you a grand total of what all your contracts are going to be when you finish entering all of those. Then in column N, it basically wants to know who is responsible for the third-party billing. Is it the health department or the contractor? So you would either put in the contractor or HD, and that is your entry. But keep in mind, you need to have it in front of you what contracts you have. So make sure you have those Word documents so that you don't miss anybody or what have you. Now, if you do choose to cut and paste, I do caution that you do go back through, because there will be some that you will not need this year. And what you need to do with those is basically clear the contents in those cells if you have a contract you're not utilizing. We'll do another one. Let's see. And I'm doing the same thing. I'm using the contract ID of the 202576 for Dr. Jones. He's going to do services in 802 again, and he's going to be at OBGYN, and then we are going to be responsible. Now, to use the ID sort, which let me put in, to show you how the sort works. Of course, you remember your contract ID must always be 5 numbers. If I want to sort my contracts, I would just simply hit the ID sort, and as you can see, it puts them in number order. If I want to see contract sort, it did not put them in order. That needs to be fixed. We'll have to fix that. And it could be because I have a capital there, but let's check it. Because we all know that J comes before S in the alphabet. Yeah, we're going to make a notation that that needs to be fixed because you can't sort it by contractor. And then, of course, the cost centers. Let's see, make sure that one works. That one works. All right. But you can basically, after you have all your contracts entered, you'll have your grand total of all the contracts for next year. That figure will carry over to your BUD form. If you have any problems with your contracts, there are somewhat embedded cheat sheets with the other tabs. The table tab. Basically what the table tab tells you is all the different scenarios or call centers that you can have contracts in. So I scroll down. And then out from that, it tells you what type or the minor object contracts you can have. As you can see, your 202 type contracts for OBGYN, you're going to see where majority of those filter to. And as you can see, they're going to be in pediatrics. You're going to have family planning for the OBGYN. But that is a guide. So if you ever get yourself confused that you can't remember what cost center is allowed to have what type of contract, this is a place you can check yourself. Mandatory minor object. There are, as in you'll learn later, or if you remember from last year, the clinic and lab, there are certain CPT codes we have to use. Well, there are certain contracts that we have to have. So you have to have at least a contract. It doesn't matter how big or how small that contract is, but it's mandatory that we have those contracts. So we are mandated to have an anesthesiology, observation hospital services, sterilization services, and then the OBGYN. And when you put those amounts in, they will actually carry over to this cell E, or E2, for instance, and then it will basically take the red away. Because that's what our goal is to get rid of the red. Get rid of the Louisville red. Can you tell me UK fan? The contract summary. The contract summary looks a lot similar to the portion under the salaries in the BUD form. And basically, this is where it compiles all that data you put in the input contracts. And then it adds all the 802s together, all the 813s, all the 700s. If you have home health contracts, 861s, that's where it adds it all together. And then it tells you, oh, you've budgeted X amount for this particular contract for that cost center. So that will let you know where you stand. As you can see, I have a total of 15,000, 15,000. And then when we see the bud form, you'll notice that same information carries over. If for some reason those do not match, you either have a formula issue, you accidentally deleted instead of clear contents, or there's just, pardon? Or there's a linking issue. If you figured out that you didn't, or you know that you did not delete, that you did all clear contents, and everything is accounted for, there's a linking problem, and if my wise advice is you need to contact or make contact with the contact you have up here. Some of us have dealt with Excel for years, so we know how to fix some of those linkages, but I would caution you to contact Melissa or Vicki to fix that on your template, because I would hate for you to do something on your template that messes up everything else, and then you have to start from scratch, and that's not a fun issue or situation to be in. But it is nice that, you do have, at all times, you have that table tab. And, I suggest if you want to print it out, if you're like me, you don't deal with the contracts, you're the financial person. You don't deal with the negotiation for the clinics. Usually that's your director of nursing if you have one of those, and maybe one of her staff members, as we have a staff member that takes care of that for us at Lincoln Trail in clinical administration. And, they keep tabs on that. So she has this memorized. I do not. So I'd caution you, as being a financial person or what have you, is to print that out and have that kind of handy for yourself, or reference this quite a bit so that you make sure that all the P's and Q's are in order. And then also, do not forget about the mandatory minor object tab, because you need to get rid of the red. And I know you may have some of these services, you may not, but we need to make sure that at least one service is included in that contract. I know it's short and sweet, but is there any questions here in the room or out there in TV?
Lisa, will you just show them, because we're talking about not deleting stuff, but the clear contents.
Okay.
Can you show them how to do that on the sheet?
Well, people may do clear contents differently than what I do, as I usually just basically hit the cell
And that's what I do.
and clear contents. I don't go up to the top and do all that. I just basically, you highlight the cell and hit your right key on your mouse, and it hit clear contents. Do not hit delete. And that's for all the templates that we utilize in the budget, because it will mess up some of your linkages. Any other questions?
If you have a contract ID that's like S187, it starts with the S, it don't start with 206.
Now, is that going to be an independent contract like a therapist or something you utilize?
Yeah.
That they're on the salary template. They do not show up on this template. And Jim or I guess I or Melissa will be going over that later. We're kind of messing with the agenda to make sure everybody stays awake. Any other questions? All right. We'll move along to the next part, and I will see you all this afternoon.
Thank you, Lisa.
You're welcome.
Okay, the next sections we're going to go over are the clinic and the rad lab path. They both work very similar to each other, so I'm going to spend more time on the clinic part, but then when you see the rad lab path, it's going to work almost the same way. Melissa went ahead and brought both of them up. First, on the clinic, and the first tab is the unduplicated patients. This is information that DPH wants each year. It provides the the amount of patients that we're serving throughout the state, and they need this information that helps with it as far as the grant information where they pull the federal dollars down, showing how many patients that we service across the state. They want this broke down by each cost center. CDP has a report, it's a 135 report. You can get it up through the end of the month. I think it's out there for March now, so you'll have 9 months worth of that information available. There's a couple ways you can do this. You can look at where you were at last year in March and get the final one for the end of the year and kind of get a percentage to see what you were at as of the end of March last year. If you had 7,000 people and you finished the year with 8,000 unduplicated patients, you're going to get a percentage off of that and take that percentage and apply it to where you're at right now. So if you got 6,000 this year, you can apply that percentage and say, well, based on what our historical information, this is what we project that information out to be. It is kind of an estimate because we don't actually have the actual full year information. When you get that, you want to make sure you fill this out for each of the cost centers. The report will list it, I believe it lists it by cost center, so it breaks it down so that you can enter this in. And of course, each of these are our clinic cost centers. 712 are dental services, and the rest of them are our pediatrics through our breast and cervical cancer, and also family planning and WIC and everything that we actually do inside of our clinics. Okay, the next tab is the actual services, and this is where we're going to be entering in any information. I'm going to go ahead and go over the tabs first, and then I'll get back to this one. But this is where we're going to actually enter the information as far as what our services are and what we project our budgeted service will be. The next tab is the mandatory CPT. This is an important tab. You got to make sure you have at least one of each of these services included in your budget. I'll go over that as we go through the rest of the template. The next tab is the rate. This is the Medicaid rate that those specific services, whenever we bill to the Medicaid companies, this is how much we will project it to be reimbursed. The rate for Passport, this is the Passport, those counties that have Passport, this is their rate. It's very similar to the rate for the rest of us, but they just have their own specific rates. The next tab is the RBRV. Each of our services that we perform, it's weighted, and it earns the RBRV. These are Medicare rates that Medicare does a lot of, they look into, they take a lot of factors into it, like the cost, the amount of time, and they assign it a rate, or they assign it this factor to tell you how much each service that you perform earns. What then is it's all collected, and then this is how all your providers code to the 700 cost center, and all of our clerical support staff code to 899 instead of coding specifically to WIC or specifically to family planning. Everybody who does face-to-face codes to the 700 cost center. Well, all those costs are collected into those cost centers, into the 899 cost center, and then based on the services that are actually entered and based on the weights for each of those services, we get that resource-based allocation. So we have all our costs in 700, and if it comes out that 20% of all of our services were WIC, in theory, then 20% of that cost should flow back to WIC. And this is how this is calculated. Don't put too much time into this. It's just trying to give you an idea of what this is. But this is how, when you look at your revenue expense report, this is how, when you see each of those clinic cost centers, this is how those costs are spread back. And then the last tab is the data mart. This is actual services that you've done through February. Each of your templates, your clinic templates, and your RadLab Path templates should have this loaded on. This is what has been basically been entered as you do clinic services through your PDF entry. If you're in school nurse, this is also going to reflect your school nurses services if everything's been entered. It's just going to. I'm sorry. Oh, I'm sorry. I thought you had a question. Okay. So that's just give you like a quick overview of each of the tabs. The main tab that you're going to be doing your budget on is on the services tab. Now, there are a couple of ways up here to start. In this cell here, you can either click a 1 and it blanks out all the services and you can start from scratch. I wouldn't advise doing that. And that way you got to go back and do all the work. You can put a 2 in there And what it's going to do, it's going to pull the actual services that have been entered through February. Again, I'm not going to advise doing this because that requires you to continue to do some more of the work. The 3 is basically, I think, what most of the templates will have on it. What that's going to do, it's going to annualize your actual services. So we've got 8 months through the year that have been entered in on the data marts. It's going to say, okay, it projects out in the full year. It's going to take that 8 months worth of services, divide it by 8, multiply it by 12, and this is what you end up with as far as your projected budget. Now, I'm going to advise you, this is exactly what you need to do. You need to start with this point right here, and then if you need to make any adjustments inside of it, then you're going to get most of these things are going to be annualized, and they're probably going to be pretty close. Now, like for example, like flu shots. We all provide the flu shots starting September or October. You may need to go back inside that. You don't want that necessarily annualized. If you give 3,000 flu shots during that time, if you don't go in and manually enter it in how much you think it should be, then it's going to annualize your flu shots. And we know we're not going to get flu shots all year. Well, not to that extent. We still have people coming in picking up a flu shot every couple of days here and there. So some people, I guess, are more concerned about making sure that they've got that flu vaccine taken, and so that they can fend off. I guess it's people who could be a little bit sicker than others. But so you want to make sure that specific services that are inside of here are not annualized because it just don't make sense to annualize certain things. Now, I'm going to go back to the data mart just to show you the columns. The data mart pulls in each of the services and the cost center that it was coded to. It pulls in the CPT code, and then it gives the CPT description. So like the D1206 are your fluoride varnishes. Well, for the total clinic, it'll give me the total that we have done by each of the categories. So we've done a total of 2 for the whole year. It tells me I've done 0 self-pay. The 2 that we did were Medicaid. In my county, we don't have passport. And I think most counties don't have passport. There's a certain section of the state that has passport. But I think they're getting ready to... I'm sorry, everybody got passport. Okay. Okay, so then everybody's going to start seeing numbers pop up in passports then. Effective July the 1st. It's also going to categorize if it's Medicare. There's an unassigned project, and I'll get to that in just a minute because this is really WIGs is what we're looking at here. Other third party, if you got third party insurances, it's going to pop up in there, and also your insurances. And what it does is it totals for each of the CPT by cost center and CPT. It's going to tell you how many services by category were done through the first 8 months. Well, this information filters back over into the services tab. And in the green columns, you're going to see that it's going to show the fiscal year to date, which is exactly that information over on the data mart. The next column is going to show the budget, and that's what it's doing is taking each of those categories and annualizing out the different payer codes, and it's going to give you what your budget is for the whole year. Now, you can scroll over like the self-pay, and you can see each column is going to have that data mart. It's going to have a yellow column where you can adjust your totals, and it's going to have the budgeted amount. Right now, the budgeted amount is that annualized amount. For example, like, let me find one here. I'm just going to go down to like we're still in school of health. We still have nurses in the schools. So one of the changes this year is that we were no longer allowed to code anything above a 212. So we've got some services up till October the 1st of the prior year that we were allowed to code 213s. So we're going to have some of those services included because that's what was included up to October. So I've got some services in 213s and 214s. I need to zero these out, and I need to move these back into the 212 or the 212s or the 211 categories. So because we're not allowed to bill for these anymore. So I need to make a change on these. I had 72. Let's see. I had 1,238. I'm sorry. I had 825 213s billed through the end of February, which was basically through the end of September, and that projects out 1,238 services. I need to move that out of that category because we're no longer allowed to bill that. So I'm going to see here, together it should be 1,529 if I move them back to the 212 with that modifier code of 25. So I'm going to zero this out, and I'm going to back up and add them to the 212 code, and I think it ended up 1,529. So what I'm doing is I'm overriding that information. This budgeted total is saying if there's not anything in that yellow column, then it's going to annualize based on what I selected up at the top. So since I put in 1,529 into that one yellow cell there for the W9212 and modifier code 25, it's now looking in the formula is going, okay, I've got an override in the yellow code, in the yellow column, so now it's going to accept that as the new budgeted total. Just like down below, I had 825 services in the data mart. I no longer can bill for those, so I've zeroed those out, and that's an override code. So now budgetarily it's saying, all right, I see that there's a 0 in there, so I'm going to go ahead and budgetarily we're going to have 0 in that column. I mean, does everybody see how that's working? Okay. And I'm going to go back up to WIC, because everything in WIC should be under project.
Somebody asked about the project eligible, so this is where you'll see this OU coming.
Right. Everything that is included for the WIC program, you shouldn't have anything in any of these categories except for project. And based on year-to-date and the budgeted projected services, I'm just going to scroll over there to the project. I think those match the totals, but if you see anything inside of the WIC categories that are not under project, then you need to zero those out and move them over to the proper project category. I don't think I see anything in here, so. There are? Okay. Okay. Yeah.
Like you got 14 in passport.
But that's for all of them, though, Melissa.
Oh, did you not filter WIC?
Let's see
Oh,
here.
you can filter WIC.
Right, you can
The
filter.
easiest way to figure it out, filter out and only show 804. And
Yeah, you can filter it out, is what she was saying, is that, and let me get the right one. And then it's only going to bring up my 804 services. That's
right. So if your total budgeted services over at 22,969 right there.
Yeah, the total services.
That matches the project eligible, then you know you're fine.
Right. 22,969. If you'll scroll over to project, I've got 22,969. So all of my services are in the right category as far as project. But if you find, and you know, there are mistakes that are made. So if something pops up in one of those other categories, you need to zero that out and basically take that number and add it over into the project code. Does that clear that up? Okay.
I have
Yes.
a comment on the unduplicated,
Yes.
before you leave.
Okay.
I don't want to interrupt your process.
No problem.
But I'm just, on behalf of the prenatal. Yes.
Okay.
Yes. I just want to let people know that we're in that unduplicated column for prenatal.
I'm sorry. They totally go.
I'm Trina Miller. I'm with the prenatal program, and I just wanted to let people know that on the unduplicated tab, that sometimes we will get contracts in that will have 0 listed for unduplicated, and that is a reason that the contract will be denied because it needs to have at least a 1 in there. So I just wanted to kind of give an FYI out, so that way when you're doing those, you should still use that 135, anticipate how many women you would serve, pregnant women you would serve, even if you do referral services. But with that being one of the core services and involved, incorporated into that core public health block grant funds, is that you should at least be able to serve at least 1 woman if they walked in the door. So that's why we need to have at least a 1 there, because we are providing funds for you to serve at least 1 woman if need be. And then, of course, if you were to anticipate serving more women than 1, you would, of course, enter that appropriate number. So just wanted to let people know about that.
All right. Thank you, Trina. Okay, getting back over to the services tab. Let me see here. I'm just going to go back to the filter and select all, and this is going to pull all my services back in. I'm just going to say you shouldn't really do a whole lot of changes inside of these services. They're going to be pretty close to what's included in there. You do need to go back in there and make sure those specific things are taken care of, like the WIP with the project. With flu shots, you may need to go ahead and override and use what you've done year to date instead of letting it annualize. You need to clean it up for certain things in there, but I wouldn't really I don't do a whole lot on my clinic template. Again, I'm going to have to change some things, like for the school nurse situation. We can't code those 213s and 214s. I got to get that corrected. So there are certain things you need to clean up, but for the most part, whatever information you come up with other than clean it up, I would just go with what you see right here. It's the easiest way to do it. And again, I'm a financial person. I really don't know a whole lot about the clinical type of stuff anyways, but the biggest thing I'm looking for is how much Medicaid they're going to generate for me. And that's what I'm going to scroll over to. I think I've scrolled past it. Okay, this also, under Medicaid, based on the services that are entered, it's also going to show you how much total Medicaid you're projected to produce. This information is linked back over to the BUD form, and this information is pulled from the clinic template back over onto your BUD form, and it populates your expected revenues for each of the cost centers on your BUD form. And I'll go ahead and jump over there. Let's see here. Pulls it to the plan tab, then the plan tab, yes.
I thought we were going to have to put in the different MCOs this year.
No.
No. Okay. Good news.
Now I'm going to scroll over to my clinic cost centers. Let's see here, and then scroll down to my revenues. Let's see here. And like for my 800 cost center, based on the services that I've entered on the clinic template, it's pulling over $64,000 in Medicaid, anticipated Medicaid receipts. So these are all linked together, and so all the information that you're entering on the clinic template, and the RadLab path is very similar to it, it's going to calculate and it's going to pull that information over and populate your BUD form. Going back to the clinic. So that's one of the things I look at, is how much Medicaid is going to generate. You can scroll over onto the right, and it also, based on the services, as I was talking about earlier, talks about the RBRVs earned. That's your relative value. So each service gets weighted. Right there's the RBRV weight for WIC for the W0208. And based on the total services that we've done, the total RBRV is 4. And then it calculates out what that total RBRV is by cost center. And this information is then used to spread your clinic expenditures. So the totals for each of these, again, this is for informational purposes. Don't touch nothing on this. It automatically calculates this stuff out, pulls it over onto your BUD form, and then it spreads the cost based on this information. So that is the other thing to look at, to make sure your services are reliable, because based on what services are entered, it's going to spread back based on those services to those specific cost centers. So again, if you got we do a lot of WIC. It seems like that's one of our big things. So most of our expenditures, let's say 25% of our services are WIC. Well, 25% in theory of your expenditures should be for WIC, and that's just the way it's set up. Again, this is for informational purposes. So let's let you know how it works. Does it also calculate the? Let's see here. Does it calculate the Medicaid over here too? Yeah, it is. Okay, it also calculates preventive Medicaid based on those services and based on the Medicaid reimbursement rate. Again, this is just where all the information is collected that is then filtered back over to your BUD form. There are some buttons up here that you can use. I don't use them. I'll just be honest with you. I just kind of leave it in this form here. It's a pretty big document. I think some people actually present it to their boards to get them an opportunity to look at all the services that's going on. I mean, my board really is more wanting to look at the financial side of it. So they would want to know the Medicaid amount that would generate, but they necessarily don't want to know every single little service. So I mean, it's really dependent on how you want to use this, but there are definitely some buttons on here in which you can get the information, and it condenses it down. And one of the views is, let's see, set to budget view. If you click on that, it's going to get rid of all those columns except the actual budgeted numbers that you're going to have that's included in your budget. So it gets rid of the data mart totals, it gets rid of that yellow column where you can adjust it, and it just puts everything down into the actual amount of those budgeted services and also the amount of Medicaid that's generated off of them. And that's just a view you can look at. If you want to provide this to your board, you can show them what services that you're providing. Then you click on the return to the original, and it's going to unhide all those columns so that you can look at those again. You can sort the data by cost center and CPT. Again, I generally don't touch this because this information is filtered back over to the BUD form, and so basically what services are on there, I make my changes to this, and then I just kind of go forward to get into the other parts of the budget. So I don't do a whole lot of work on it, just kind of try to keep it cleaned up. Now, the mandatory CPT tab, you have to have at least one of these services included on your budget. So I've got several of them that we've not done the service this year. That's why nothing's showing up. But I still have to go back and include one. It's a requirement. Most of these, I think, are family planning requirements of the different type of contraceptives. So you still have to budget at least one of these. If you see please enter at least one service on the plan on the right-hand side in the red and yellow, if there's a service missing, and you have to go ahead and include it. Now, there's a couple ways to do this. The way that I actually do it, I just click on the Data Mart tab and scroll to the bottom. Okay, now I'm going to go over there and write this down because I can't remember. Let's see here. So, family planning, which is the 802 cost center, I need code A4266. Okay. Then I go back over to Data Mart tab. And to add this, the first thing in that little note's going to pop up. You have to enter new because it's a new code. So new. And then, let's see, cost center was 802. The bill class, you can use 99. I mean, that's just like a catch-all. You can use 10 for a physician, 20 for an ARNP, and 99 is basically for all your nursing staff. Since we're just entering one, we just need to get this entered. I'm just going to enter 99. And then I'm going to enter the code, A4266. I'll scroll over and just usually put it in the self-pay. And then I'm going to go back over to mandatory services, and it's going to show that now I've got one budgeted into the clinic spreadsheet. And then I'm going to go through each one of these and continue to do it to make sure that all these say planned. Does everybody understand how that works? Melissa, is there still a situation where you have to put that apostrophe in front of some of them, or has that been taken care of?
There are some instances, yes, where you have to put, if it begins with a number or a letter, if it begins with a 0 or a letter,
okay,
then you need to put the apostrophe in. You can try it without it. If it doesn't work, then put the apostrophe in.
And what she's saying is
those are in the budget instructions.
They're also in the budget instructions, but if you have like, I need to plan an 813-00940. Okay. In order to do this, if I enter 00940, and I'm going to show you, it may just read this as a number. And if you do that, you need to put an apostrophe in front of that 0 to make sure it reads it as a CPT code. So I don't have any of these plans, so I'm going to go over to Data Mart and type in new. I believe it was the 813 cost center. I'm going to use 99 as the bill code, and it was 00940. Okay, when I type that in, it's reading this as a number. So when I go back over to the, let me include one for self-pay. So when I go back over to the mandatory CPT, it's still not showing up that I budgeted any of these. So I need to go back over to the Data Mart and enter it again and put an apostrophe in front of it, and then 00940. And what that's telling it, it's not a number. It doesn't need to be read like a number. It needs to be read like a CPT code. So when I go back over to mandatory services, well, now I've got one planned for that specific service. So did everybody see that? If you got a CPT code with a 0 in front of it, you might need to put an apostrophe in front of it to make sure that it looks at it as a CPT code, or it's not necessarily going to count it as a budgeted service.
Did everybody in TV land get that?
Is there anything I'm forgetting to go over on the clinic? Did unduplicate it yet? Okay. Anybody have any questions about that? Yeah, adding may be one of the trickier things. If you need some help adding, get in contact with somebody at DPH and they can walk you through it. I think that there is another way to do it. There's a button, yeah.
Whether you push the button on that screen or you push the button on the data mark tab, it's going to automatically take you to the data mark tab.
Right. I'm going to go ahead. This is the other way that you can add that service. You can click on this button that says Enter New Record or Manage Existing Record. It's going to take you over to the Data Mart tab like Melissa said. You need to hit New and then do exactly the same thing. So I'm going to type New and then the cost center, 813, the bill class 99, the CPT. I'm going to make one up because I can't think of one right off the top of my head. A4266, and then self-pay 1, and then you hit close, right? Just hit close. Okay, hit close, and it's going to automatically include that as the last entry. And right there's that new code that I put in there. And then it's also going to, once you put it on this, the Data Mart tab, it then filters it and puts it back onto the actual Services tab. Does everybody see that? So there's two ways to do it. Pressing that button is going to basically work the same way as going actually to that Data Mart tab and entering it in. I'm going to just talk briefly about the Rad Lab path because it basically works exactly the same way. I mean, there's very little difference in them. Okay. I'll just go over the tabs real quick. The first one is services, just like the clinic template. Again, we got mandatory CPT codes, just like the clinic template. You got the rates. These are a lot of these services are what you will see on your contracts as well. These are basically your breast and cervical cancer codes that you bill for. Rate for Passport. There's relative value that the lab services earns, and then the Data Mart. And this is, like I said, this is very similar to the clinic template. Again, I would leave it at free because that annualizes what your year-to-date is through the first 8 months. And it gives you a projection. If there's certain services inside of here that you feel like you need to clean up, you need to go back and look at each one of them. I don't spend a whole lot of time cleaning this up, just at those ones that I'm specifically aware of. Of course, on the mandatory CPT, it works exactly the same way. I have to budget, let's see here, for 88307. I don't have any currently, so I'm going to go back over to Data Mart and go to the last entry. I'm going to type in new. That's for cost center 813. I'm just going to put in provider 99 because let me see what that is. Okay. And then the code is 88307. And then again, I'm just going to make sure there's one budgeted in there and go back and check. And now it's showing up that I've got one budgeted. Again, these work very similar. The Rad Lab path works very similar to the clinic one. If you can do the clinic one, I think that the Rad Lab path it's really got less information on it. It should be pretty similar as far as completing.
You mentioned WIC, it has a project eligible part 2.
It does, on the Rad Lab path, it does, okay. On WIC, again, you got to make sure that all the services are project. So we got 2,531 services in WIC, and I'm going to scroll over to project 2,531. So all of my services that have been entered are entered under the correct category of project for WIC. Got to make sure if you have anything outside of project, your budget's going to be sent back, and they're going to tell you that you need to fix this. You got something showing up outside of WIC under project, or it's showing up under a different category. Got to make sure you get that cleaned up. There's a button on here again that works similar to the one on the clinic where you can enter the new record. You can set this to the budget view. I'm going to go ahead and click on that. It's going to hide all those columns that are for the data mart and for the entry, and it's going to actually show you what you got budgeted. You can click on this and return to the original view. You can print the whole thing out. I'm not going to click on that. I don't know where the print would go in here, so I'm just going to leave that alone. But that's basically, they work pretty much the same. Again, DPH, Melissa, Vicki, Jenny, they can all give you some help if you need some help with specific parts of it. Has anybody got any questions about this, or if there's anything specific that needs to be gone over? They're telling me I got to talk for 40 more minutes, so I don't have nothing else to say about this. I'm sorry.
I have a question, a general question about the MCO expansion providers.
Yes.
So the revenue codes for clinic, there's no new codes for Anthem or Humana. We're supposed to include services in the regular Medicaid section. But my general question is, and maybe somebody out there knows, where does DPH stand on the contracts right now? Because we're starting to see these people show up at the clinics, and do we do the services for them, or do we send them somewhere else? Are we going to get paid? Does anybody know?
The teachers.
All right. Melissa can answer that for you.
As far as the contract, I'm not sure on the status of that. That would be a Mike Togle question. At the lunch break, we can ask him, and maybe he can come in here and talk at the beginning of that about that. There are new revenue codes set up for the Humana and Anthem. They are in the administrative reference, and they're I believe Humana is 901 and Anthem is 501 for the revenue codes to code those revenues when you receive them. I will look that up and verify that. I know the Anthem is not in the administrative reference. It will be in the new one, but the Humana one is already in the administrative reference.
Is Passport going to stay 002?
Passport's going to stay the same even when it goes statewide. David, does that answer your question?
Yes, I was just looking on the BUD form, and I didn't see those codes in the 463 section, so I was just wondering what we were supposed to do with that. So thank you.
Yeah, the Medicaid is all lumped together for preventive Medicaid. If you have home health, it is separated out for each one of the different payers of Medicaid, but it is difficult to separate those services by payer. So as of, same as last year, all of that is rolled up together, whether it's Coventry, Passport's the only one that's separate. We just kept it separate because it's always been separate, and we'll look into combining it next year. Are there any other questions about anything
Melissa?
Yeah.
This is Thursa. So, but when we're doing when we're coding those for our reports, we are differentiating between those, right? To know where the monies came from for our audits.
Yeah, when you're coding it into your revenue and expense report, you're going to differentiate between Coventry and Wellcare and so forth. And there's a different revenue code set up for each one of those. But for budgeting purposes, it's all going to be lumped up into one because we haven't been able to create a report that will feed in there so you all can separate it out yet.
Oh, okay.
But when you're doing your projection report, it's separated out on there, and it's separated out on your financials. But for right now, home health is the only place that it's separated out on your budget. Are there any other questions? What time do you want me to be back?
We're still ahead of schedule, and we're trying to figure out what to do for our lunch situation. I don't want to interfere with TV Land's schedule of having certain people come in for certain areas. If we go to lunch now and come back at 12:30, is that going to cause issues in TV Land with your folks getting to see the portions they want to see, because we'll be starting early again? So it will not affect anybody in TV Land getting to view the parts they need to see. I'm not getting any responses.
Jenny, I could get you back on schedule. We couldn't hear it out there as recently we interfered, so we didn't hear anything after about 10:30, before 10:30. Could you go over that again?
No. Okay, we're gonna break for lunch. You want me to say 12:45? We're gonna break for lunch and start back up at 12:30. I know the agenda says 1 o'clock, but we're gonna start with the salary at 12:30. So everybody come back at 12:30.
Thank you. Okay, we're back. Thank you all for returning for the FY15 Local Health Department Budget Training. Ms. Lisa Pollock from Lincoln Trail is now going to present on the salary, supplemental, and home health templates.
I have a disclaimer to start. Salary tab, yes, I've played with this tab since these templates were created. I say we're a good 10 years or more we've used these templates. However, I've never taught the salary template. So I may forget something or what have you, but Melissa's back here and Vicky's back here and Jim. So if I forget something, like I said, I can work it up, no problem, but actually teaching it I never have. But I've done all the others that I'm going to cover. Of course, you need to go to your 15 salary template. And you will notice there are a lot of tabs at the bottom. Of course, you can only see about 5 of them now, but if you carry on over with your arrow, you will see that there are a couple other templates. Some of these you won't even have to access or look at anything at those because they're blank on some respect, and that's for some of the data to be filtered down from DPH with the data marked. The first page you will see is the Input LHD information page. You will need to enter, of course, your health department name. Of course, the budget year, of course, should be 15. Of course, there will be 26 payrolls this year. There's not a 27. It's a couple of years till we hit that 27th payroll again, which everybody kind of freaks out about, oh, I got an extra payroll, what I got to do with that, or the whole understanding of why, with one extra day, that we have a whole new payroll. Then the next section is our employee fringe benefit rates, and then the employer, and then the tax shelter benefits for pre-tax deductions for employees. Of course, it is not a mistake when you look at cell C14, contribution this year for retirement will be 38.77%. That is increased from the 26% that we are now currently paying out on retirement this year. That is not a mistake. It's not supposed to be a 2 instead of a 3. It is 38.77. I hate to say when I do the budget, but that's the only thing I know is when I do it. So when I hit salary template, usually the first place I go is not here per se. I mean, I go and see retirement because I want to see what the retirement states or that percentage. But actually the first place I go is I scroll over to the tab that says Employee Benefit Worksheet. This is a worksheet that was added probably about 3 years ago from Randy Gooch, who's at Jessamine County, which some of you remember Randy. He used to assist us with these trainings. And he created this. This was something that worked for him and thought it looked good, so it was included. And it's very easy, very detailed. He did an excellent job telling you where you pull some of this detail that you need, what reports from CDP. The first part is your health insurance. And basically you would enter exactly what it says, enter the month employer cost, and he has given you the guide of use the most recent Kentucky Health Insurance billing report that you receive. And then how many employees are covered, and then what percentage you expect for cost to increase. Rule of thumb, I usually use 5%. I like to be covered because I do know in January our rates are going to increase. Now a rule of thumb is that the cost is supposed to be shifted more on the employee, and that the employer won't have to pay or contribute as much in insurance, but we have seen that's gone up and down with us because they can change plans. I mean, we've changed from, United Healthcare in the past to Humana, so there can be all kinds of changes, so those rates can change. Then after that, you need to put in how many employees are waiving the coverage. Then the unemployment information, and of course it's listed what reports you would pull that off of. And some of these will either be off an invoice you actually receive from the vendor, like Keiko. Others will be reports you pull down from CDP. And then dental, if that isn't something that applies to your agency. Of course, workers' comp, flex benefit coffee tree, pre-tax deductions, employee health insurance, and then the pre-tax deductions, employee flex benefits. After that is completed, you will notice that about every one of them where it has the red, of course you will get rid of the red as you supply the information, it says where to enter this amount. And you would enter that back on the initial information tab, the very first tab that you see. So let's say, for instance, my current insurance cost per month per employee is $700 because I have some employees that cross-reference and I pay $1,000 a month on them. It happens, some $9, some I don't hardly pay a couple $100. It adds up quickly. I'm going to say on my recent bill, right now I have 113 employees, I'm going to say that I have 75 employees currently covered, and I'm going to expect a 5% increase, which actually my employer cost, that's the employee cost, $700, but if I'm paying that on all my employees, I would multiply that by the 75. So actually you would put your total amount that you're going to pay out, which I'm just going to put in an amount. Well, it's not that much. And what happens to the 7,000, it did not carry over. Right, that amount at the bottom, well, you need to carry over.
So it won't automatically carry over?
No, nothing automatically carries over. That's what it says. You have to enter the amounts in those tab areas. And then
This tab is optional. You don't have to.
No, you don't have to do the worksheet. It's just a guide. It's just an easy, quicker reference, to pull some of that stuff. But if you're seasoned and you've done this before and you don't need that, that's fine. You can just go pull the reports as you know. Or you can already have done some estimations. Everybody does their things differently. Some people look at the employee cost monthly. Some wait till budget to see some of that rises. I'm doing reports, usually monthly, looking at different things because of things have changed and staff have changed. But after you complete all those, once again, you would take those amounts, where it says enter this amount into the input, that's what you would carry over to that information page for all those different categories. The next tab is input full-time hours. Before I start putting hours on employees, the first thing I do is I go to CDP and I run my 271 report. Your 271 report will basically estimate your increment, if you're getting an increment. And what it'll basically ask you is what current increment you're getting, what do you expect for next year, what you project, and then what payroll run you just completed. If you did just closed out, load back from run A, you would put A there on that report, or you'd put B. And that will print out to you overnight from CDP, and you can download it on your e-reports. And it will tell you if you put 2%, it'll tell you that increment. What that does for you is that we all know that our employee A may be at 6 months at this increment, their old increment, and then if you assign a 2% increment, the last 6 months, they're going to have another rate. It factors those in so that you know what they're going to cost you, because you can't really think, okay, this employee is only going to be at this rate. Let's say you have an employee that's going to be at their old rate for 10 months and they have the new rate at 2. It factors that in instead of you estimating that the whole year, that increment. Some have argued that why not go ahead and have them at the higher rate the whole time. You can do that. It's just what works best for your agency. Me, I just, basically base it on, I know they're going to be at this amount for this many months. They're going to be at this amount that many months. However, on the 271 report, you can call that report up as many times as you want. However, it has to be on separate days. So day 1, you may say, hey, I want to see what it will cost me for a 1% increment. The next day, 2, or if you're lucky, a 5. So, but you can have those run consistently, but they can't run the same report on the same day for different increment amounts. That's one of the first things I pull to look at before I even start full-time hours.
Lisa,
yes.
does that take into account when their increment
It takes
is?
into account their, yeah, it does. The 271 report. It does it for you, so you don't have to do that calculation.
Okay. Okay, thank you.
You're welcome. Your information should be loaded from just your employee's ID, their last name and their first name, and then hours that they have actually utilized in each cost center through 17 payroll periods. Now, this is where you can kind of see if someone has coded incorrectly. You can kind of do a self-check on that when you're going through and looking at your employees. And you can go back and correct that and do a journal entry to change that payroll distribution for this year. So like, for instance, someone coded, let's say 810, and they should have only done hours in 813. What little direct salaries we do put in those cost centers, you can go do that journal entry real quick, because you can see it here because they'll pop in. Or a cost center you do not even have at your agency, you'll see that's been added here, and you say, oh, we didn't even have that program 14. I need to go do that journal entry before I close out fiscal year 14. So that's another way this template kind of helps check things, as well as in some of the other templates, that if something got miscoded or something with the CPT code you don't use, like in the clinic and lab, you can go make those corrections so that when you do close out this year, it'll be more smooth for you. Of course, after you get your 271 report, and you figured out what kind of increment first you want to try. Usually I do about 2 to 3 different budgets based on different increment amounts. Of course, a lot of it is depending on our allocations when they get dropped, what you can truly do. But you want to get as much information as you can, because we do not know when allocations will drop. The first thing you need to do is print out the list of employees that are listed on full-time, or at least that's what I do. And I double check to make sure that these are my employees, number one, that the employee still exists, and to make sure I'm not missing anybody. So I usually pull my last check register. Even though this is taken from DataBart, I still make sure, because you'll have employees who have retired or resigned, or employees who have simply changed job positions, that they could be on here, not on here, or on here twice. For instance, if you have an employee that was in environmental and now they have changed positions and they're your director, they're on here twice because they coded hours to environmental, and now they're coding hours to 898. So you need to make sure that you pull the right employee and their right ID number. If you have any questions on that, of course, you can go look at their PPI screen through CDP, or your best resource you have in your health department is your human resource director, because they know every employee they have on the listing. Of course, you will have some of that too with the check register, of course, with payroll, but they can help you. Plus, you may not be aware of any hires or any vacancies that you may have next year, but your human resource director may already know those. So you have your list of your employees. You know what your increment rate is. Now, what I usually do is I farm my hours out. I take this template and I manipulate it, and I divide it up by my departments. Like, I've divided up, here's environmental, here's preparedness, here's my community, here's my hands, here's my first steps, here's administration, and used to home health when we had home health agency. I would divide that up for me on a separate spreadsheet, and I'd go through and make sure with those directors, here's your employees' hours, Do you still see that? I do not dictate the hours going on here. I use all the different puzzle pieces in my district to tell me what they're going to, because I don't work clinic, I don't work environmental, so I don't know who will work how many hours where. So I utilize the workforce that we have. They're the experts. They're in charge of that program. They know where their employees that they supervise are going to work. So I basically take this and I manipulate it into some different Excel spreadsheets based on departments, and then I give them a deadline. They turn that back into me. When I get that, of course, I do not disclose the rates with them yet, because we don't know until my board approves what my rates are going to be. But I keep the master, so I kind of know what the costs are. But I want to see what hours, and of course, if they have needs of a vacancy or if they know someone's retiring. Then once I get all those back in, then I actually start working or manipulate this template. Of course, the first thing you see is it says in row 9 that I have an employee last first. There is no employee in my health department that has an employee ID, EMPID, last or first. So what I need to do is clear out the contents, because that is no employee. Of course, I believe this is Pike County's information.
That's on everybody.
Yeah, but make sure you delete that off, because, I mean, yes, you're not going to put any hours in there, but I don't like extra stuff that doesn't need to be in my budget. Then you'll proceed then to go down to the individual employee once you've gotten the hours that you know for per employee, and you would need to put in their rate, which I don't know how much this person makes, but I'm going to just plug in $15 an hour. I'm going to put that in there. Of course, the blue column, the column F, is just some detail basically, and that's the budget without your leave hours. The next column is what total hours you have budgeted for that employee, which it has already filtered or entered data into all the cost centers they've coded before and analyzed it based on recent coding. This is where their hours are going to be for this year. It must total $19.50. Now, you will have some employees that do not total $19.50 on this template. You have those employees that are 1,200 hours. They will go on this template. They get benefits. If you have an employee less than that, less than 1,200, that do not get benefits, then they will go on the part-time template that we will cover. So it takes the hours multiplied by the rate and gets you what the total budgeted salary is for that particular employee. Then you start going across and reviewing the cost centers based on whatever you feel, or you can leave it alone since it's already at $19.50 and say, okay, they are going to work exactly like they did this year. Or if you've got with that program manager and you would manipulate those hours. For instance, Miss Ray Jesus Rangel or whatever. Okay, your new director. He's going to work 10, 72, and 700. Well, as Jim has mentioned, that's his new director. He's not going to be coding to 700 now. He will be at 898. Oh, okay. Well, he's still going to see patients. That's why every health department's different. Every health department's different. But you would basically go across and manipulate hours as you need for employees. Now, me, I'm one of those, I don't like to see a cost center that I'm not using. So, I usually hide them. Don't delete them, because you'll mess up all the calculations. And what I basically do is I go to the top of the column and I just shift and to hide it, because I don't want to look at cost centers I don't have. Now, I caution you, if you do that, to go back and unhide to make sure that something didn't accidentally get inputted. Because you're going to have some weird, funky number when you go on and this carries on. But I don't like to see stuff that I don't need. Even on my bud form, I hide those cost centers. And you know how we all get those printouts every month, the revenue and expense, and how many of those sheets that you print off, if you print it, some do all electronic, that you have to trash. Because even though you have them inactivated. Well, sometimes you inactivate them, and it passed over 3 years to have them inactivated, and they still print out. So I just toss them to the side. So I hide these as well, the same concept, because I don't want to see it. It's too much. I got enough numbers I got to deal with. Don't want to see it. Then you scroll on over, and of course, every employee will have to have leave time, so you need to make sure that the $19.50 that was included for your employee, that they did have time and leave, because your employee's going to take some time off. So you need to scroll over to the column that has $8.95. Now, what I usually do, or what I tell my managers on the leave time, they know their staff better than I do, but normally a 297 is what I'm going to give them leave, which would leave 1653 of regular time worked, and the 297 would be leave. But if you know employees want to have surgery, you know employees want on maybe maternity leave, something like that, then you can adjust that as needed. And that's where you would manipulate the 895. Now you'll notice there's all these columns after the 895 cost center, which are all the different types of leave. What happens is when you put in your amount of leave, it's basically will apply that leave to the major program, like environmental leave, with all their hours pretty much are environmental, then it kind of is an environmental leave. Hence the function code we put on our timesheet with environmental. Same with if you're administration, it's going to hit that home health, if you utilize the home health leave, but it spreads it to the cost center or the program that has that majority of leave, and that matches up when you do your timesheets and you have your function codes. And some people review function codes on a monthly basis. Me, I'm not too big concerned about function codes. I mean, I'll go and look at certain things, but there are some tracking mechanisms with function codes. Like for those that deal with some of the travel, there is a separate travel code that you can look at for the staff that do travel. You can use that function code and know that their time was travel time versus actually worked when they got to their destination. If you have home health and you do on-call, you would need to add that as well. And that would be, you base that on previous. When we had home health on call, I never budgeted home health on call. And this is my fourth thing here doing a budget. I never budgeted it, but we always were able to maintain with what I had already originally budgeted, so I have never budgeted the on-call, but you can. Then next we hit those wonderful indirect call centers that nobody loves to explain indirects. I like to explain it. I'm one of those weirdos. Not like resource allocations to explain those too. But you will need to make sure those staff that utilize those call centers, you have their time in there. Of course, usually your space is going to be your janitor. And then at times, your clinical director or another administrative staff may use an 897 if they're the ones, if you have multiple locations, that are dealing with the maintenance components at your site, if it's not the janitor or a maintenance personnel. Of course, 898, and then, of course, 899 for those that utilize that, and then all the way on to 903. You would utilize those indirect cost centers. Now, of course, remember, if you have an employee that does no longer with you, you need to clear the contents, do not delete. If you have an employee that is on there twice, you need to make sure you pull the right or the most current employee ID and then assign their hours and then delete the incorrect one, or not delete, clear contents of the other. Now you'll notice that you may have some employees, for instance, we have Miss Sherry McCoy. I don't know what happened to Sherry McCoy. My first assumption is Sherry retired. Sherry may have just decided to leave. I don't know. But she is no longer there, or if she's no longer there, and if that's not the case, she's a brand new employee that came on during the fiscal year, and that might be the only hours that have been coded at this time. I don't know the situation. She's not my employee. But in this situation, if she's retired, once again, you clear the contents. If she is an employee that is brand spanking new, you need to go over back to the call centers and make sure you get her enough hours that she has the 1650, which includes her leave time. Or she may be an employee that's told Jim, guess what? I'm going to retire. I think I'm going to retire in October next year. That's a far out there to tell him this early, but it happens because I've had some that's told me. Then this amount could be just exactly what she's budgeting for the year that she thinks she's going to be there. So she may be there 10, 9 payrolls. When I have these situations, yes, it's in red, and of course, all we hear all day is, if you see red, you got to correct it. That's not the case here on the salary, because once again, this is probably an employee that's getting ready to retire, and so if that's going to be the case, I always put a comment. I'm big on commenting on things, and I'm big on color coding. I used to have one of the most colorful budgets until they changed to these templates. Ask anybody at Lincoln Trail about my calendar at the office. It is so color-coded, I have my madness of my colors. So what will happen for Sherry? I'm going to assume Sherry's retiring. So what I would basically do is go to that cell. Since it's under the 1950, I would simply click Write, and I would say Insert a Comment. And I would just put a comment just for that. Vicky's another good one that can tell you I do a lot of comments. Vicky's the one that gets stuck with my budget every year. And it helps Vicky out, it helps me. Because, you know, Vicky's busy. Vicky doesn't have time to call every health department that she deals with to ask them one little simple, well, why is that in there? It's red. Are they leaving? What's going on? I just tell her up front, I'm done. This is it. We're gone. So they love the comments. So put your comment, the more of the comments, the better of why. Because we all do things differently. And you can't assume that what I'm doing at Lincoln Trail, you know, Jim's doing at Pike County, we're doing at Marshall County, you know, we're doing at Bullitt County, Franklin County. I mean, I can't assume that. So, you know, make sure, you know, if you want to comment and you feel comfortable doing comments, because sometimes comments can mess you up a little bit, or you get in the wrong cell and then, of course, trying to delete them. But go ahead and enter those comments. Of course, after you have all your employees in there, you're ready to roll. Just make sure the employees you have here are employees that get benefits. They have at least 1,200 hours or up. You will have employees that will have less if, for instance, they are retiring. Or, you know, they're going to leave. I mean, I assume retired. But you can put that detail. And that's that template. Of course, the next little tab you see beside it that's in gray is that's just where the information comes down from the data mart to feed some of this information. Part-time works the same way. However, these employees are employees you have that do not get benefits. Could be your variable hour employees. Some of you have that. We have that with our HANDS programs and variable hours. This is where you would put those on there. The question was asked earlier about contracts with someone that has a contract that starts with like an S or an N. That might be an interpreter, might be someone else that you may utilize, a speech therapist. This is where they would go. Now, some of you may get your template and you'll have people, or you'll have either a last name, no first name, no ID. You've got to go search those. Because I've noticed, usually every year on mine, on this template particularly, I will have a lot of S's and N's for like my interpreters, or when I had speech there, those kind of things, that would show up here, but it would just be their ID number, and I wouldn't have their employee name. So I would have to go find those. So make sure that every ID you have in there, you have a last and first name. Because what happens when those cells are filled out, you'll have this employee count here on the side, and that employee count drives some of the stuff that is on your first template with the LHD information. And you will do the same thing here. There is no correct amount of hours you should have. You may have some people 800. You may have somebody on here for 100 hours, and then you would put their rate in appropriately. Just make sure that if you have information you not needed, that you clear the contents. So it works pretty much the same way as the full time, except what hours are required to be on here. Just remember, if someone's retiring and they're getting benefits now, they go on the full time with a comment. The next template we have, of course, is the part-time. And then we have the salary spread. Some people look at it, some people don't. I do, because I'm always curious, and I'm one of those that I like to match. So, because what happens is this information carries on to the bud form, and I like to go to each program and to make sure what it says it's charging, each cost center and fringe benefit package, it matches. Because you never know, a formula may get deleted or something like that. So I always go back and kind of double check and see some of how this leaves pay spreads go by county or by cost center. Now, I will caution you that it can happen, and it's nothing to get upset or stressed out or what have you, but sometimes you can look at the columns with the totals, and it may not match on the bud form, and it might be $1 off. That's nothing to panic. It happens. Sometimes it's just something with the rounding errors that will happen, and so it may show it in red. And if you can track it, that it is just like $1 roundup error or $1 down roundup error, it's no big deal. Because I've had that happen before. Mine was actually a $2, and I went back and tracked it, and hey, I know it's going to be off because if it's rounding. So that can happen. Of course, if you have something crazy here value, that means something's not entered, and that's where you have to make sure that everything on that first tab with the information tab is entered on your benefit package. And then some more other templates that deal with the data entry that comes in from Data Mart. There is a payroll period schedule, which mine we have to change because we run a little bit different because some are like the Sunday to Sunday, some do Monday, some, it's just different. So we always have to adjust our dates by a date on how ours is. But you can manipulate that if you want it. You can share that, print it off, share it with your staff so that they don't call you, "Do we get paid this week? Is this travel week? What is this?" You can do that. Or what our human resource director has actually done is he's compiled a calendar for the year that tells employees, this is when travel's due for us in finance, this is when payroll's due to finance, and then if we know holidays that I need travel in X amount of days early, and I need payroll X amount of days early because we have to have a 2-day leadway with my bank. So I have to know, throw in the holiday and the 2-day processing, so that way staff pretty much know ahead of time, oh, you gotta get your stuff turned in early. Because I'm on the concept, we're all adults. If you don't get it turned in, it's not my problem. You need to take care of yourself to make sure you get paid. But usually we'll go try to track down the employee and we'll call them and we're nice. But of course we do everything direct deposit. I mean, our travel's direct deposit and our payroll is direct deposit, which is a little harder if there is a mistake made, because usually you've got to go ahead and send that file. You can't, once you send it to the bank, you can't say, hey, I need my file back. I need to make corrections, so we'll make a correction the next payroll period. And then of course travel, we pay employees travel at that kind of, not really at their leisure, but travel, we will pay you every 2 weeks travel. You can hold it out a month, or you can hold out your travel for 3 months and pay. Some people like to hold it out 3 months, get a bigger check. And of course, those are direct deposits. However, around about May or so, I'm starting with my beautiful emails about get your stuff in, because I got to close out my fiscal year. I want as much expense captured as I can. But, you can, like I said, share this payroll schedule if you feel like it with your staff or not. It's up to your leisure. Of course, this one, once again, shows just, all the different leave, what spreads to what on the leave. And, of course, that's basically a template you don't even need to bother looking at. And, of course, we're back again to where we started with the benefit page. Are there any questions on the salary template? I think I got everything, but I'm not for sure. I'll go back to the office and start and be like, I forgot something.
Down at the bottom,
Mm-hmm.
where it says HB1 retirement.
Yeah, the retirement.
Make sure that when you get your allocation, you have to key it in there and on the budget form. And the reason why you key it in here is so that it doesn't spread that amount of expense when it's spreading your fringe benefits expense.
I will repeat that. Make sure when you get your allocation for the 426 that you must put it here as well as on your bud form. So do not forget that important information. Any questions, anything?
I did an 895 on the bud form.
Pardon?
An 895 on the bud form.
I assume that it'll go into 895 as it has in years past.
And the expense will equal that amount in the budget form on 895 too, just like it does in your finances.
Mm-hmm. All right. Well, I guess we've all picked ourselves off the floor after seeing the retirement contribution. We'll move on to the next template.
Excuse me.
Yes.
On the flexible benefits, they say to look at report 131 for the employer's portion. It's not in 131, it's on report 147.
Is it
That's
147?
the bi-weekly, and then you double it.
Okay, thank you. We'll make sure that gets corrected.
And I was gonna say, on your retirement, keep in mind that there is $14 million.
Right, there's that
in the budget
still in the
right
governor's
now
budget that nobody knows exactly.
Cover the full increase
Yeah.
from
Y'all
14
figured
to
out
15.
what percent of the increase that'll cover?
It's supposed to cover the full increase.
So in other words, if it was 26 and now 38, what will be left after our allocation should still be about 26.
Mm-hmm. And that's, the governor has the budget right now for veto power.
Right.
I don't look for that to be stricken or vetoed, but it's not a final document yet, but that's progressed through the whole session without any questions. So I just wanted to make sure you were aware that $14 million was still there as of now to help assist the health departments in covering that increase.
Lisa, I don't know if
Yeah.
it's a big deal, but this
Okay.
form says 2012.
Oh, yeah, I've noticed certain things. Of course, we got the templates maybe Friday of last week or something.
Yeah.
So some of the templates, like, I'm used to doing bud form, so I didn't even look at this until basically this morning. But yeah, there's different things here and there, dates, but I mean, that's just cosmetic kind of stuff that can be fixed for next year. That it doesn't have any bearing, but yeah, it's been pointed out, but thank you. That tells you what year we first used it. Fiscal year 12. Anything else? All right, we will move on to supplemental. Okay, supplemental. Basically what happens in supplemental is the hands information. Years ago, we used to have First Steps on here, but basically it's hands information because First Steps changed to their system of TOTS. I had to make sure because I got 2.0 in my head with hands, TOTS, so we don't have to budget that anymore. This is basically the same kind of concept in a way of having the 1, 2, 3 that was mentioned in clinics. You have your option to go as a 1 and blank, or 2 to have fiscal year actuals, or 3 to analyze. Now, this data, I've been told, did not come down from DataMart. This actually came from program staff at DPH. So a lot of the old gibberish kind of stuff we used to see in years past, some odd things like 800 popping up on here, you won't see that this year. Of course, we have a couple of different types of hands programs. You have the hands that we're all familiar with, the 853. And then there's the multi-gravita, and then there's the federal that pop in, or the different kinds of hands programs that are out there. And what happens is it takes the cost center, tells you what the cost center name is, and then it tells you the service or CPT code, what have you, that is utilized for those different areas. And then you have if Medicaid, or if it's professional or paraprofessionals, and then the data that has actually been fed by the program staff. So where you see this in the yellow column, which traditionally is usually blank and we have to fill it in, that's where they have filled that in based on what they have record.
It's in the green column.
Oh, the green, I have it on the wrong one, the green.
Yellow is the annualized.
Annualized is the yellow. The green is what the staff up here, even though it says DataMart, it's not DataMart. It's the detail they have up here at DPH. And then this is the analyzed. Of course, this is the column with the rates. The rates have not changed. I think they've been the same probably 5, 6 years. I don't think there's been an increase in a long time on the reimbursement rates. Now, those that have all 3, or those that only have like the multi-gravita and then the or I call it traditional, it's not traditional hands, but the 853, we get those allocations for all of them. And we have in years past been told, oh, you can budget over that allocation. That is not true this year. There's a little bit of change. I think Melissa touched on it this morning, but we need to make sure that the 853 and the 760, for those that have the federal or they have the 853, you cannot this year go over the allocation. Now, if you have the 767, the multi-gravita, you can go over the allocation. So that means if you want to meet your allocation, you need to make sure, or you have to be able to explain that you have these particular types of service, it being professional, paraprofessional, or an assessment, that it comes to that allocation amount, or you can go under. But 853 and 760, you can no longer go over allocation. 767, you can. What happens after you put in the services that you think you're going to do for the different areas? It will take that rate, and then it will multiply that and give you what your total amounts, and that's where you can match it up with your allocations. It would actually be here in the gray columns in row 12. So if you have federal hands, which looks like Pike County has it with Jim, they have some federal hands, he will need to make sure that this $167,000 he has put in is either less or right at his allocation. If it's over, he's got to do some adjustments to the services in 760. Or actually, yeah, that's correct. Get my 760, 767 mixed up. I don't have 760. Now 767 is different. That's where he can go over the allocation if he has that. So I have 767, so if I have an allocation of 150,000, I can do services either under 150, over 150, or right at 150. I mean, each county knows their caseload. Me, I go to my hands director and say, what are your program people doing? I'll work with you. We'll come up and see what we can do. Can we meet the allocation? Can we not meet the allocation? Where do we stand? Because I have her assist in those items.
That's the one that you can exceed the 10%.
It's 10% is how much you're allowed. Of course, 853, once again, you need to match that with your allocation to see if you're under or right at it. And then, of course, you have the non-Medicaid. And you would do the same.
The 767, for those of us that did not have it this for
Mhm.
2014, is there a chance we'll have it for 2015 or no?
Do not know that answer. That would be a program staff.
Okay. What's the question?
If those that don't have 767 for 14, will they have it for 15, or that opportunity?
That would be a Brenda English question. I do know she's already done her allocations. How she chooses who gets the funding, I'm not for sure.
Okay.
You'll have to contact her.
For those out there that may have not heard the response about if you did not have 767 this year, is there an opportunity for you to have it in 15? That is unknown. That's something that needs to be basic contact Brenda English in that area to see if you're interested. There's no guarantees that if you're interested that they have the money for you. And then, of course, 760, I do not know what the criteria is for the 760. We do not have that.
Nobody has both.
Right, nobody has both.
Nobody has both.
Okay, nobody has 760 or 767. They're two separate.
Yeah.
You can only have one or the other.
767 did not have 760 in that person.
Okay, the next tab, of course, is the refresh tab, and that's where it pulls the data that comes down with the services. And then, of course, the rates are just strictly what those are, is the rate of reimbursement. And like we said, don't know of any increases to the rates. They're pretty much going to be stuck at the 110, 160, 150, unless we're notified otherwise. And that's pretty much the...
Add a service.
Oh, you want me to add a service?
Yeah. And put it in the cost screen and the cost center.
Yeah. Let's see, what do I want to add? What's a good one to add to show? Okay. I'm going to add 767. Of course, you put the comma. Of course, I'm just going to abbreviate. Of course, I don't deal with their CPT codes, so I don't have to memorize. Yeah, it's the same thing, but I was trying to see which one I wanted to pull. I'm going to pull a para-visit. So you would have to input the CPT code. And then you would, basically what I would do is I would go up to the one that is a sum of the Medicaid para-visit, and I would do my control C, come down and do my control, oh, it doesn't do control V, it saves. Well, let me do that. See, you learn all kinds of things in TV now. Still won't let me do it. It's protected.
We'll take that function off because it's a do not.
Well, you know what? I don't like when you take off do not functions, because that's how I live with control C, control V. I know you're teasing me because I like those shortcuts. I live in those shortcuts. Okay, so we've added 767. Of course, I know it's multi-gravity, but I'm not going to write it all out. And you don't really have to either, because, staff at the state, they know the difference between them all. Then you would put the service or CPT code, and then, of course, the name of it. Then you will need to go to the yellow, and as you can see, based on that rate tab, it's already populated what the rate of reimbursement of 110 is going to be. So you just need to calculate services, and I'm going to say we're going to do 10. And it will multiply that out and put that in the appropriate column under 767. So 10 services for the Medicaid paraprofessional visits reimbursed at $110 gets us $1,100. And that's how you would add one. I think anything else? Is there any other questions?
Lisa, this is Leah with the Cumberland District.
Hi.
Hi. In previous years, we were instructed to put supplemental information that had been keyed into CDP's supplemental system in here, even though there wasn't a reimbursement rate. I'm understanding you to say that's not necessary this year, is that correct?
As I understand that, it's not necessary unless that's changed again, but as I understand, no. We do not, just strictly the hands and the multi-gravida and the federal this year.
Okay, thank you.
You're welcome. Anything else? All right. Well, for those of you that don't have home health, you can take you a short little nap, then we'll come back and do bud form. But I'm going to go over home health. No, we're not. What's that? Oh, I need oh no, she's got one up here. Even though Pike County doesn't have home health, she's got my template up here. Yeah, there's a template up here for me, even though you don't have it. I don't have it anymore either, so. Okay, you need to pull the home health, the 15 home health template. Of course, as with most of our templates, you've got to do that in Able, if that pops up for you. And then you will notice, as it has in years past, this template hasn't changed. Me and our home health director, when we had home health, we actually created this template. It's probably been about the 4th or 5th year this template has been running. Of course, it is broken down. Of course, years past we had those 2 different templates we had to enter, and it was a bear. So we basically got down to one nice little spreadsheet that you could basically look at everything based by the cost center and by the service that was being provided. So we've got that broken down into the 861 home health, the 862, the skilled nursing. Of course, if you have the 863, 865, and so forth. As we have done the last couple of years, unlike the clinic, you are going to hit all your payer sources. So you will notice you'll have Medicare, PPS payers, Medicaid, Coventry, WellCare. Of course, you have Anthem now, and then Humana, self-paid insurance, and so forth. What needs to happen here is you basically will budget those services that you're going to do. And you just enter those amounts. And what happens after, you have to put in your number of episodes, and what we've tried to do is, you see the little red, like triangles in the corners? What those are little self-help checks, and basically tells you different things. So for instance here, it says enter the projected number of Medicare episodes, and that was on report 2128. Now, some of these reports may or may not have changed. We are no longer doing home health in Lincoln Trail. We sold our agency back in August. So if there's been some changes to the reports, I'm not aware because I don't pull this detail. I mean, we're doing little just to kind of finalize some of our accounts receivable. So if some things have changed on report numbers, I apologize because I'm not aware of that. Of course, the next one, you would enter the number of episodes for other PPS payers. Then you would put in what your different rates are for those particular services, your Medicaid rate or what have you. And I'm just putting in some blind numbers. I know 85 used to be in there and stuff a while back, and 110, it was varied, but just going to put some numbers there. Of course, you'll notice you have this percentage collectible. You need to enter, if you have ancillary supplies, you'll have to put that in there, that cost, and then what's your percentage of collectible. And then again, you'll do the average reimbursement per episode. So you would enter that also off the 2128 report. So basically first, you need to put in your projected service numbers, and you put those in by your different payer sources, it being an MCO, or it being self-paid, it being insurance. Then you need to put in the rates of reimbursement. They may have went up, they may have went down from last year. That I cannot answer. And then you need to put in your projected total receipts for your supplies, for Medicaid, and then self-paid and insurance. And then you need to put what you think is collectible. You have to do your average Medicare reimbursement for episodes. And let's see, what else am I forgetting? Like I said, it's been a while since it's like, oh, I forgot already. Got out of the payers. I'm not done. There's plenty more still in home health to cover. But what happens is it takes your rate multiplied by your service, and it will carry those into the columns A8 and so forth. and that's your reimbursement you think you're going to get. That information will carry over to your bud form, so you won't have to fill that out. It carries it over for you, which I will open that up. And you'll see that in home health, for that particular payer source, Medicaid, $46,750, which came off that template from home health. Okay, then you will notice the estimate of the $465 copay deductible revenue. You will need to input that. And then, of course, all the revenue that is dropped into 861 will drop into that total column. Then you have a provider tax. You have to pay on services that are received as revenue, and at cost center 861, which is your home health, you have to pay 2% provider tax on that. Now, as a side note, we had received and had to do a refund back from a payer out of 861. So they will, if you have overpaid the tax, which I think we overpaid by $71 because we're closing out, they will refund your money back, the Kentucky State Treasurer. So if by mistake you accidentally overpay, or you had to pay 1 month and then you had to do a refund back to somebody, it does adjust. Cost settlement, of course, yes, it says cost settlement fiscal year 10. We know we've got cost settlement 10, 11, 12. This would be where you put your projected cost settlement that you will receive in 15. It should be 14's cost settlement because 13 should come down before the year ends. So this should be 14's. And then the administrative charge. Not seen administrative charge in a while. That's something that is generated from up here. It is an invoice that you will receive for services rendered from DPH. That will come from Melissa Freeman, and it's basically an amount. It's basically kind of the assessments, some of the computer stuff that they will charge you. See, how many quarters are we going to be charged, or those?
You're getting ready to get billed for the first 6 months.
The first 6 months, so first 2 quarters of home health, you're going to have that administrative charge. So just be on the lookout for that bill, that you will receive that. And then you can take that and you can kind of figure out what you need to budget for next year. If your home health is pretty much the same as it is this year. Of course, we know everything's going up and down, up and down. Then, like you did with 861, you'll basically do that with 862 and so forth and so forth. You would put in how many services you're going to do, what the reimbursement rate, it will generate the revenue, and then that revenue will carry over to the bud form. Now, if you have program carryover in home health, good job. And of course, that can be that can be utilized when you're doing the bud form, which Melissa will explain. You may have some other health department revenue, doubtful, but if you do, you would put that revenue, you would have to plug that in because it will not manipulate that one automatically. If you have other revenue, which it can happen, I mean, it's possible. You could write a grant for home health to get some funding. I mean, it could happen. I mean, we've never done it, but that was where you would put that revenue. And then, of course, you know, interest, you would plug that in if you need to have utilize interest from your bank to actually offset a deficit. But Melissa will go more in detail on that. But I just want to let you know that there is potential for revenue that is not put on the home health template. They could go here. It's very doubtful that you would, but you never know if you need to utilize some carryover, if you have a deficit in 861, or if you have some other kind of funds that come in, like a grant you write for home health. Because there are some out there, but, you know, we just don't utilize it that much. Trying to think anything else on home health out there. Like I said, you know, any questions you have on this template, of course, like I said, it's been a while since I've played with it, and I'm not playing with it this year, however, since we shut down home health in August or so. You can contact me, you can contact Melissa, but you will make sure, you know, you be on the lookout for that administrative charge invoice that's going to be coming down the pipe. Because I know we've not seen one in a while, so that's what that's going to be. So not to panic, but that's what that's going to be, and that you need to budget for that accordingly. Also, if you have 461 funding apparently it has to be deducted from the 861, 467 revenue. It has to be deducted out of that. And that is in your instructions with home health. It has to be deducted from 861, and then it has to be added to the deducted from 867 and put into 461. So if you have estimated federal funding in 461, you deduct it from 861, 467, and add it to 861, 461 on the budget form. Any questions for those that have home health?
Based on the cost settlement, that'll be what you're estimating you're gonna get
In
15. Right?
For 14 services.
But if you think you're gonna get the check before July 1st, it would be nothing there.
Correct, but but usually those drop around mid-June when you get them. Because like we closed shop, we sold in August. We technically closed everything out about December, and so we've been told we'll probably get our settlements about the same time as we always have, even though we
think you're at 2015 settlement before July 1st, why wouldn't you put that in there? Because that would be income next year.
You can. I've heard different arguments on that. Me, traditionally, I don't claim it until, I know it's coming. 15, you never know, because things could change. They can take those settlements away in home health. And that has been a talk before, is, maybe increasing some of the reimbursement and getting rid of the settlement.
So you're
But
saying
you can read away.
put a 0 if you don't know?
You're going to get a settlement of some more, because you're going to have your settlement for services that you're completing, and you will complete by the end of this June. So I would put a figure in there. I would make sure I would account for that, because that is going to be, yes, we're cash basis. We only recognize revenue when we receive, but you're going to get that cost settlement. They're not going to take 14s away from you. That is a given. Now 15, they can decide 2 weeks from now, we're going to increase rates, no settlements. I don't think that will happen, but it could. So I would make sure I have at least my 14. Now, there was one year we had to put 2-year settlement. There was some issues that got behind, and it wasn't a peer's fault. It was just dealing with some of the payer sources, and so we actually got 2 years once.
Yeah.
It happens. It happens. But I try to put in as much as I can, on that information, so that's why I always put in the one that I'm getting ready to end budgets, what their cost settlement's going to be. Because I've got services I did. The only thing I'll probably put on this template for my home health is I know we did services in July. And so I know I've got that 1 month of kind of a settlement. It's not going to be big, but I'll make sure I have that in there. It may be $1,000, it may be $500. I'm going to use it because technically I'm going to receive it.
So, just out of curiosity, what do you do with that cost settlement now that home health is gone?
That cost settlement? Well, my assumption, I don't know, because we still have some things we're doing cleanup. I hate to get all personal, but we have some cleanup going on at our site since we have closed. We have a staff member on contract that comes in, and that's what they're doing. They're cleaning up. And, we had to get our aging down, or our outstanding claims down. And then every now and then we'll get something in the mail that says, oh, we overpaid a claim, like from Humana or something like that, and you owe us $2,000, what have you. So she's working those up. So I have some of those expenses, but I see I'm going to have surplus when I end the year in home health. Of course, we had one staff member that actually did stay till October, and then we have a contracted, and then everybody else was gone. So I'm still going to have a surplus. I'm assuming, of course, I haven't been given my guidance or me saying, this is what I want to do. What do you think about it, Vicki? I assume what mine will do is they'll be restricted into my balance sheet as home health cost center. If not, hopefully, maybe I could just go ahead and roll it into unrestricted. And the reason why I argue that I want to go ahead and put unrestricted is I know for a fact I have my trend, I know the numbers, and I know for 5 years I supplemented home health out of my unrestricted reserve. I had to, because it's a sinking ship. Especially the 868 Medicaid was killing me. And if you take what we sold our home health agency for and what I've had to supplement over those years, I'm going to do well to break even because we had to supplement a lot. So that's my argument is, why can't I just stick it, because I don't have the program, let me stick it unrestricted and be done. Now, hopefully, all my other programs end good and I won't need it. But, in years past with home health, we have been given the luxury, because not all my home health cost centers have ended in a deficit. Some may have had a little bit of a surplus. And what we've been allowed to do which I probably did the last 4 years, got approval, is if I had a cost center and home health, let's say 861 ended with a $200,000 deficit. But let's say I have 862 and I have 865, I was able to do some things to help offset that. But you have to get permission for that, and we have that written permission. But of course, things have changed now, so that may not be accurate anymore. But I just know we got permission to do that. And there's things that you all may have permission to do, at your site that no other health department does too. But yeah, but hopefully, right now, I want to move unrestricted, but I don't know because I've not started closeout. But, just looking at what we sold it for and what we've supplemented it through the years with my unrestricted, it makes sense to put it back there because we'll never go back into home health business. I say that because, we sold off our certificates, of needs, so I'm assuming, that's what I can do with it. But it may have to sit right here on the balance sheet. Any other questions? All right. We'll move along to the next template.
You're done. We're on break. Take us a 15-minute break. It's about 10 minutes till 2 by that clock behind you. So let's say 5 after 2. Be back and we'll start on the bud forms. Okay, if everyone will get seated, we're gonna pick back up where we left off. Okay, before we went to break, we had the question about cost center 767, and if you didn't have funding in 14, were you expected to get anything in 15? And I emailed Brenda English, and she said that if you were not funded in 14, you would not be receiving funds in 15. They did not get any additional monies. And your 15 allocations are based on the number of services that you're averaging now, plus a little room for growth. So there's your answer to that. Next up, we have Miss Melissa Freeman, and she is going to discuss the bud form template.
Okay, the bud form is like the nuts and bolts of your whole entire budget. This is the last template that you need to work on after you've done all of the other templates that we've discussed today. This is the last one to work on because everything you've done so far is coming into the bud form, and this is pretty much your final product as far as financial is concerned. The first tab is the Input LHD Info tab. We have already pre-filled your health department number and your health department name, and that feeds into all of the other templates. So you don't have to do that on any other template. You don't have to do it at all because we've already done that for you. It just, that way you know that your templates are linked properly. If your health department name and number is at the top of every template, then it's linked together pretty well. The next thing on this tab is if you have already gotten your budget approved through your board, when you submit it, then you can put a yes in there saying I'm going to send you my board minutes with my budget. If you have not had your board meeting, which is not a requirement, and we prefer you to go ahead and submit your budget as soon as you have it finalized, go ahead and submit it so we can get it through the process, because trying to get a budget approved through AFM staff and all the other divisions is a long process. So go ahead and submit your budget as soon as you're ready. You can put a no there, and then in the next cell, put the date of your board meeting so that we know when to expect your minutes. They don't have to be signed minutes. They just have to be a draft copy of your minutes showing that your board met, you discussed the budget, and they have approved your submitted budget and any increments that you're going to have for the fiscal year. If your budget has an increment in it, then you need to put the percentage of your increment, whether it's 1, 2, 3, or if you're very lucky, a 5% increment. Haven't seen one of those in quite a while. The next tab is Input Local Receipts. In the purple, you can see that we've already entered a county and what the minimum 1.8% requirement is for that county. If you're a district, we have all your counties listed here and all of your minimum 1.8% requirements per county. That's just telling you what the minimum amount of tax money you have to have in there. If you are lucky and your board gives you more than the 1.8 minimum percent requirement, you would put in that amount over here. Say they gave you $700,000. And as you can see over here in the over or under, you're budgeting more than what your 1.8 minimum requirement is. They only give you the 1.8%, then you put in your 1.8%, and your over and under is 0. One way to know that you're budgeting the 1.8%, say you only put in $500,000, it's going to turn red. And that's going to tell you that I have not budgeted at least 1.8%. You have to budget at least 1.8%, because that's the rate that the commissioner has been set for many years. It has not changed from 1.8%. So this is kind of like a guide to show you whether or not you're budgeting the proper amount according to the 1.8%. Now, once you put in your tax money, you don't have to enter it in onto the BUD form. This automatically will feed over to the BUD form, and you have the option, you have the option of either letting it spread automatically, or if you put a 0 there, you can go in here in the yellow cells and hand key it in. I suggest you use the 1 and automatically spread, because your local tax dollars is the last funding source that you're going to budget when it comes to the programs. I do know that some of the boards are particular about where their money is used, so if you want to do the automatic spread, you can adjust down here. We'll go over that in just a minute too. The next tab is square footage. Once you have done your salaries, this is one reason why you do the BUD form last, because you definitely have to do the salary template first, is it'll feed salaries over into here, and once those salaries feed in here, it'll show you the programs in which you have salary. For every program that you have salary in, you have to have square footage keyed into this column right here. In this cell F9, you need to put your total square footage. If you're a district, it's the total in all your buildings. If you're a single county, it's just the total square footage in your, if you have one building. It's all your buildings, no matter how many buildings you have. Yeah.
We have pass-through points that we usually don't do square footage.
Yeah.
But we have one that we always question about. She's like part pass-through, part our employee.
Okay. On the pass-through column, if for some reason, if that employee is not located in your building, but that employee is located here, you're going to put a Y in there, and it's going to say pass-through employee, and you do not need to budget square footage for it. But if that employee is in your building, then you need to have square footage for them.
And the state will pay that?
Yeah, up to your allocation.
Okay.
But if they're located in your building, then you need square footage. If they're not located in your building and they're located up here in our building, then you don't put square footage. That's where the yes, no comes from.
Even if you have, like, for instance, we used to have the 759 for, you have those regional coordinators and fairness, you were given an allocation, you don't pay for salaries, but you had to claim their square footage. Only certain areas have those. But of course, I don't know if this year they're gonna roll that back in again.
821.
Or not, but you do have those scenarios where you have somebody that, yes, you do not put them on your salary, but they do occupy space, and that is written in the master agreement with the DPH that they will pay for their space.
Yeah. The key is if they're in your building, square footage. If they're not in your building, no square footage. And so if they're not in your building, put a Y there so we know not to expect square footage put there. If you put 5,000 there, and there's only one, 5,000 there, this will, if there was salary in here, this will be gray. If that's red, then you're off somewhere. It either means you've got square footage in a program you don't need to have square footage in, or you don't have square footage in a program that you do need to have square footage in, or you haven't allocated the proper amount of square footage throughout all the programs. Over here, once you do your 897 budget, you need to do that before you do the square footage too. Once you do your 897 budget, it's going to calculate from your 897 cost center how much is going to each program. So that's very important too, to make sure you do your 897 budget before you do the square footage. Okay, here's the big one. Input BUD form. Start at the top. I suggest when you're doing your bud form that you have last fiscal year's 916 and your most current 116, and be utilizing both of those to fill out your bud form as a guide on where to budget expenditures and which programs and how much. Salary and fringe will automatically feed over to the bud form, so you don't have to worry about that. You've already done the salary template. It's all in there. Contracts. You've already done your contract template. All of that's going to feed in there. You don't have to worry about that on the bud form anymore either. It's going to automatically feed over there to you. Now, when you come down to travel and space costs and office operations, provider tax, administrative support, and medical supplies, automotive, other operating, capital, all of those are going to have to be hand keyed in. You're going to have to key in those expenditures into the proper program and ensure that you have budgeted what reality is. That's why I suggest you use, for this fiscal year, I would use FY13's 916, and I would also use, by the time you get to doing your budgets, you'll have March's 116. I would utilize both of those to determine the amount of expenditures that you're going to budget in each one of your programs. A couple of key things to let you know. Office supplies stock 343, that's your paper that's used throughout the whole health department. Anything that you buy that can be used in any program, that needs to be budgeted in 898. It can only be budgeted into an indirect cost center. You do not want to budget 343 into a direct cost center. You only want to budget it into an indirect cost center. If you buy office supplies that are for a specific program, say HANDS or EPSDT or maternity or family planning, you want to code that to 349. That seems to be a big thing of why we send some budgets back, is because they get those backwards. 349 is for a specific program. 343 is used for any program and goes to an indirect cost center. Central support taxes, provider taxes only if you have home health. Central services is only if you have home health as well. As Lisa was going over the home health, you have not been billed for administrative support for home health in the last couple of years, but we are billing for that this fiscal year, and those bills will be coming out shortly. I hope to get that done next week. Medical supplies, budget those in the appropriate cost centers. Use your 916 and your 116 to determine those. Yeah.
On medical supplies, so it's the difference between consumable medical supplies, multiple cost, and consumable supplies, single cost.
I am not a clinician. I'm assuming.
Multiple cost is 700. If it's spread, you put it there. If it's for a specific program.
Right. That's the way I look at it. That's the way, I would think. If it can be used in any program, like your gloves and needles or whatever that's going to be used for any program, it would be a multiple
I've
cost
always
center.
used it kind of like the office supplies,
Yeah.
where if it's an indirect, like $899 or $900, you use the $359, and if it's a
Or you can use 700, because if it's a clinical
Right,
thing,
700 too.
yeah, but
But
if you're
it's a
buying,
specific cost center, then I always use the 363.
yeah, if you're doing something that's only for that specific cost center, then yeah, that's the way I would look at that too. I hadn't really looked at that. Automotive, that's only used if you actually have vehicles. Other operating, insurance is coded in 898, unless of course you have Ryan White. Then we do have some health departments who have Ryan White fundings who pay insurance for patients with AIDS. That will be budgeted in the Ryan White Cost Center. Audits, that's always budgeted in 898 as well. This is the audit contract that you do not put on the contract template. As they said earlier, you're going to budget that expense directly on here, even though you have to have a contract. Capital. Only budget in capital if it's one item more than $5,000. So if you're budgeting for computers, one computer normally is not $5,000. So that would go under office equipment, non-capital. But if you're buying a server, per se, if you wanted to buy your own server, that would be more than $5,000. So you would want to put that in there. If you're buying an air conditioner unit, that would probably be more than $5,000 for a health department. That would go in there. It's one single type of good or service for more than $5,000. That is what a capital item is. The indirects are automatically going to spread for you as well. Once you do your 897 through 903 budget, all of that's going to spread for you. And once you do your clinic and rad lab path, the allocable visit procedure and lab rad, that's going to automatically spread for you as well. So the expenditure side, a lot of it is already done for you. The things that aren't done for you, you can use history to determine, to budget your expenses for the next fiscal year. Okay, receipts. I know the big question is right now when you're going to get your allocations. As Jenny said earlier, until the legislators and the governor have signed the budget and it's all said and done, we cannot give you your estimated allocations. This happens every 2 years, where it's a delay in getting your estimated allocations. So, but you can go ahead and do the rest of your budget and right now until you get those estimated allocations. You don't have to wait till you get your estimated allocations to start on your budget. But this is where you will key in all of your allocations once you receive them. If for some reason there's not a yellow cell and you get an allocation, I apologize. I tried to cover everything. But just let it, you can either color it yellow or just key in the number or call me and I'll walk you through how to color it yellow if you need be. But mainly, you only need to key in the yellow cells. You've got all your state funding, which is an allocation. 423, however, is 172 money off your balance sheet. If you have 172 money on your balance sheet and you want to budget that, that's fine. It's just make sure that you're budgeting for revenue that you do not currently need to close out the current fiscal year. So say you have 172,712, which is a big one out there, on your balance sheet, but this year your 712 program is running into a deficit. You may need some of that money off your balance sheet to close out this fiscal year, so you're not going to want to budget everything you have on there in that program. And you only need to use restricted reserves to go to balance out your budget. So say you have a deficit on your bud form of $1,000, but you got $3,000 on your balance sheet. You only want to budget the $1,000. You don't want to budget everything that's on your balance sheet if you don't need it. The federal money, 438, as you can see, there's already a number in here, and that's coming from either 760 or 767, whichever one is tied to this one. But the 760 and 767 from the supplemental will automatically feed in to the bud form, so you don't have to worry about that part either. It's automatically going to calculate in the bud form, and you don't have to. But everything else that you get money for, you'll have to do. 439, those are federal grants that your agency has personally applied for. It's not funding that comes through DPH, so you all would only be the ones that would know how much to budget for those, are the grants that you're going to have for FY15. 440 restricted carryover, that's not used a lot. This is 173 money that's on your balance sheet. I do know that there are health departments that have carryover for 767, and there might be some from 760, which is the two new federal HANDS programs. If you have carryover money on your balance sheet for those programs, you may use those to supplement your current year budget. The biggest thing with the 173 is I would ask me or Vicki if you can use that money before you budget for it, because some of it is allowable, but the majority of it is not allowable to use in following years in the budget. So I would just ask before you use any of the 173. 456 is donations. You all know the trend of your donations, so budget accordingly for that. Service fees. School board contracts. If you're lucky enough to have a school board contract associated with your school health, that needs to be budgeted in 858. Program administration contracts. That's wherever you have a contract with another agency, not a health department, just another agency to provide services. That's where that would be 460. Your Medicare, that's a big one that gets left off because you're doing your services over on the clinic and the Rad Lab path, but there's no revenue tied to it on the clinic or Rad Lab path, so you have to come in and manually key in the revenue you expect to receive from Medicare, whether it's clinic. Home health will automatically feed over, but clinic does not, so you have to budget those receipts. And with Medicare, I would use your history to determine the amount of Medicare receipts you're going to receive. For the majority of health departments, it's just flu shots is what you're receiving Medicare for. So just use history to determine that amount. 463, HANDS will automatically come from the supplemental, so you don't have to key that revenue in. EPSDT, that allocation, it's the exact allocation amount that you're going to get on your estimated allocations. I know last year those were not sent out with the regular estimated allocations, so we haven't heard this year how that's going to work. My suggestion is if you don't get an estimated allocation for it, don't budget for it. That's just my suggestion. Preventive is all the MCOs wrapped up in one, except for Passport. It is Coventry, WellCare, DMS, Humana, Anthem. Is that all of them? All of them that you budgeted the services for on the Rad Lab path and the clinic template. The revenue calculated from the services you budgeted for that are Medicaid services is all wrapped up into that one preventive line. It's not broken out by the payer. So it's automatically going to feed into the appropriate cost centers for you based upon the receipts, the services that you budgeted for. The same with Passport. Passport's always been separate because it is always in a separate region. Effective July 1st, it's going to go statewide. So everybody will be receiving Passport. I do know that some health departments outside of Region 3 currently do have Passport receipts, and that is mainly because of foster care. If the foster care child is in a Passport region and then they get placed in a home that's outside of the Passport region, their Passport follows them. So that's the main reason why some counties who are not in the Passport region might have Passport. And then home health is going to come from the home health template. And home health is divided out by the payers between all of the MCOs.
Was that like that last year? Do you remember?
Mm-hmm.
It was. Okay.
Yeah. All I did was take Kentucky Spirit and change it to Anthem.
Okay.
That's all I did.
That was going to surprise my home health guy.
Yeah, no. Yeah, that's all I did for the home health was where the line item that Kentucky Spirit was in, I just changed that to Anthem because formula-wise, that was the easiest way to do it.
Well, we still get Kentucky Spirit money though for home health.
Yeah, but you shouldn't buy FY15 because all those claims should be already.
Oh, they're gone?
Yeah, they should already be taken care of by 15. I'm hoping. If not, you're not going to budget for them. But if you do receive them, you're still going to code them to the 703 or 701 if you happen to get. I didn't take that away because Anthem's changed to 501 and 503. So like if you receive money from Anthem, you're going to code that to 463-501 if it's preventive, or 463-503 if it's home health. Yeah. And Humana is 901 for preventive and 903 for home health. Yeah.
And passports,
It's gonna be
04, right?
Yes. Passports 002 for preventive and 004 for, yeah, I didn't change that one either. It's the same as it always has been. It's just going to go statewide. 464, program income carryover. This is money from your balance sheet. That's 174 currently on your balance sheet. And that can be used in any program. The only exception with that is home health. A lot of the home health agencies have 865, which is EPSDT, that provides a surplus year after year. And that surplus on your balance sheet, those restricted funds, can be used to fund 861 or 868 if you're closing in a deficit. That's the only time that you can interchange the money from the balance sheet to a different program. Whatever program it's restricted for is the program you need to budget it for and use it in. 465 is like co-pays for your insurance. If a person has insurance and coming to the health department, they have a co-pay. That goes to 465. Just use history to determine to budget that. That's one that gets left off sometimes because when we're reviewing your budgets, we look at your most recent 117. It shows that you received $1,000 in 465. You don't budget any, so we're kind of thinking you forgot that one. And it's an easy forget. So make sure you budget that. 466. The only thing that feeds into 466 is from the environmental template. The 560 on-site sewage fee that's being calculated on the environmental template will feed over to the bud form, but 466 is also in the clinic. All of those clinic cost centers, which you receive 466 money for, you will need to go ahead and budget for those receipts as well. That's one that gets forgotten too because you're budgeting for the services on the clinic and Run Life Path, but that money doesn't feed to the bud form. You're going to have to calculate those expected receipts yourself. The same for insurance, 467. Any insurance claims that you receive, you're going to have to feed those into the bud form yourself.
But the home health insurance is automatically carried over.
Yes, if it's, yeah, home health, most of its receipts are calculated in the home health plan and feed over for you. Yeah. 468, if you have a contract with another health department, say Anderson County has a nurse practitioner and Franklin County doesn't have a nurse practitioner, but they want Anderson County's nurse practitioner to come to Franklin County one day a week, and you have that contract in between. So the revenue that Anderson County receives from Franklin County will go into 468. That's what that's for. 469 other is like my least favorite revenue code of all times. This is where you put stuff you don't know where else to put it.
You always ask for a list for it.
And at the end of the year, I will always ask for a list of what you got coded to 469. So just a heads up, come July, you need to submit a list of all your 469 receipts of what you received. So we can make sure. One reason why is because sometimes it's a federal grant, and you might really should have coded it to 439 instead of 469. So, but
Can I ask a question?
Yeah.
Sorry. Of course, we do a lot of flu shots, that kind of thing, contract out. When they enter that in the system, it comes up as it's supposed to go into usually 810, 469, sometimes
Right.
800 or something. But then they do a direct deposit that comes through on our L drive, and it'll say 810, 422. And I've always done it to 422.
That's the money we give you. Yeah. What happens is if you're doing a contract with like the school to say that your Board of Education says, I will pay you to give all my teachers a flu shot.
Right.
When that money gets posted into the system, it automatically puts it to 810,469. But when you're the only one that has this instance, when you're doing our flu shots for us up here at DPH, for the lab, I believe it is, you do their flu shots. When that revenue gets posted, it's going to say on your 358, 810,469. But we're paying you those funds to provide those flu shots. That's why it's 422.
So it should go under 422.
Yeah, because we're providing the funding for that. Yeah, that's where the difference is. If it was a regular contract with another type of business, it would be 469. But because DPH is paying on that contract, it's 422 because that's how we have to account for those funds.
Okay. So basically it's on my L drive EFTs, then it goes to 422.
Yeah.
Okay.
That's what it should be.
Okay.
Where's the Humana Vitality?
Yeah, cost center 758 is for Humana Vitality. I know when it first came out, they did a PowerPoint presentation. If you've never had Humana Vitality and you're going to start that, you can contact me and we can send it to you. Or if I remember, I'll put it on the financial toolkit on the L drive so that you can have access to it, because that's about all I know about it.
But there was a training that was done, I can't think of the date, maybe the 11th of March, something like that, on Humana Vitality. It was part of the CEP, and you got those PowerPoints. Those have been revised, so there is a revision to the PowerPoints that we had at that training. And I think Sharon or someone may, or maybe Kevin, I remember those came down, so make sure you have those.
Yeah, I'll look into that.
It changes a little bit, because there was confusion about the report, that some of the reports that it was pre-billing, because in the initial purpose, it was pre-billing report, we had to go under interest. So make sure you get the latest.
Yeah, we will get that PowerPoint and put it in our financial toolkit on the L drive. That's where we try to store as much information as we can as possible. Okay, and all of that revenue is going to go in as for 67, but it's not highlighted in yellow. But it is 467. Guess I need to fix that for next year. Okay, 480 is interest that your bank, if you have a bank that is paying you interest, you're lucky. But that's where that revenue goes. It can go into any program. It's not restricted by any means. Okay, 427 is the retirement. How that's going to be allocated, we have not determined yet. But as of right now, it looks like y'all are getting an additional $14 million to cover the difference between the 26.97 that is currently the retirement rate to the 38.77. So that allocation statewide has yet to be determined how we're going to calculate it. But you will be getting an allocation for that amount. Oh, this is 427. This is, sorry, I was thinking about retirement. 426 is retirement. And you will be getting an allocation for that amount. And it will go into 895, 426 up here. And the reason why we say to put it on the salary too is so that it will leave that amount of expense in 895, because we don't want that to spread. Because your 426 allocation for retirement is to cover that retirement expense, so you have to leave that retirement expense in 895 and not let it spread to be paid by other programs, because it's already being paid through general funds. 427 is the DEI, the Department for Employee Insurance. That is something that was set up last year where DPH used to pay that for you on your all's behalf, but now you all are paying that, and we're giving you the money to pay for that. And that revenue can be used in any cost center. So you can do the automatic spread, or you can put it where you want it based upon your deficit. It just cannot be used somewhere that already has a surplus. It can only be used in programs that currently have a deficit. 428 is your State Core Public Health Block Grant. Last year we let you automatically spread that based upon your deficit. This year you have to think about it, where you want to put it, and you have to manually key in the amount that you want to put into each program. Now, it is still restricted as to what programs you can put it in, so you can only put it in the programs that are highlighted in yellow cells. There's also a list in the budget manual of the approved cost centers for the State Core Public Health Block Grant. That's the only difference with that, is it's not going to start with 500 and start spreading for you based upon your deficits. You're going to have to manually key it in. If you want to start with 500 and start keying it in based upon your deficits, go right ahead. It's wherever you want to put it. That's where it's going to go. 453, 452, and 451, as I said before, all come from the local tax receipts tab. I think I only talked about the 451 there, but if you're a health department that receives money directly from the fiscal court, you don't have a public health taxing district, then you would key that in under 452. And I think there's one county in the entire state that gets money from the city, and that would be 453. So it just depends on who you're getting your money for, but it's your local tax money. So it's whether it's public health taxing district, the fiscal court, or your city's giving you money. And I would suggest for all three of those to do the automatic spread, so where it's, because it's local tax dollars, you can budget it wherever you want to budget, but let it spread based upon where your deficit is. That's the last thing you're going to spread. And then you have your 490 money, which is automatically going to calculate for you the amount of 490 that you need to use. We have over here in this blue cell, we have keyed in what is on your balance sheet as of February the 28th. Which is usually what you have at the end of the year, because you don't really adjust your 171 by any means throughout the year until you do closeout. But that's how much you have. That is the maximum amount you can budget for, technically. My suggestion, and I used to not think this, but in the past couple of years where times are getting tough and more unrestricted is being used, you really need to look at your current situation and your financials, determine how much unrestricted you're going to need at the end of this fiscal year, and you only need to budget the difference between that. Because I would really hate for you to budget this full amount that we've keyed in here for you for this fiscal year, and then you need that much more to close out the current fiscal year. So you really have to look at your financial state for this fiscal year before you budget your unrestricted. And as we said before, unrestricted really should only be used for non-reoccurring expenses, such as a computer upgrade. That's not something you're doing every year. So that's what you need to use your unrestricted for. Or an air conditioner unit, or, stuff that is kind of like your savings account, and it shouldn't be used to pay for salary, and it shouldn't be used to be paying for travel or program supplies, stuff that you have to pay for every year. So I highly suggest that when it comes down to the unrestricted, you really look at your financial state this fiscal year before you submit your budget, to make sure that the amount that you're budgeting there is appropriate and that you're not going to need to use some of those funds to close out this fiscal year. I know I've said that multiple times in the last 2 minutes, but I highly suggest it. All right, down here at the bottom, you'll see your budgeted revenues and expenditures and what your surplus or deficit is. For most parts, you're not going to have a deficit because your unrestricted is going to automatically take out all of that. And you cannot submit a budget with any deficits in any program. You have to adjust your budget appropriately to get rid of any deficits. If you have any surpluses, I would highly look at those programs to make sure you budgeted what you needed to, as far as expenditure wise. Because if it's because of money that we've allocated for you, then you need to make sure you're utilizing that allocation to the best of its ability. I would budget for whatever you can to make sure you're using up that allocation. I will say this about 766, and I believe the case is going to be the same for 774, Child Fatality Review. They do not pay indirects on those allocations. So when you're doing your budget and you put your allocation in, you need to budget your expenditures for direct expenditures to match the allocation. Do not include your indirect expenditures to match the allocation. You need to put either local or unrestricted dollars into that program to pay for your indirects. Because when it comes to the end of the year, that's what's going to be paying for your indirects, is your local or unrestricted dollars. So that's one thing that we saw last year, and that's one of the reasons why that kept on getting denied, is because they didn't understand how the local and tax dollars and stuff worked. But anyways, that's my suggestion, to make your budget as real as possible. Don't use your allocation in those two programs to cover the indirects. Use your local or unrestricted. The next tab is summary of all programs. We put this in last year, and it's kind of a helpful tool if you wanted to just use this to submit. It depends on what kind of detail your board wants. If they want the simple version, you could print this and you can show this to your board. This is what my budget, line by line, instead of trying to have to print that bud form, just the total line. This was requested last year.
Does this fill in automatically?
Fills in automatically. It automatically comes from the bud form. So it's a kind of a quick and easy thing. Okay, here's the plan tab. As I said before, when we were going over the bud form, all of your Medicaid receipts are calculated in the bud form for you based upon your clinic and your Rad Lab Path services. This is where they come from the clinic and Rad Lab Path templates. They all come in here for Medicaid and for Passport. This has all your receipts, and it even has HANS receipts in here as well. We have a column over here where you can put your percentage of denial rates, because even though you've calculated you're going to receive X amount of dollars for that service, we all know that the MCOs and Medicaid are going to deny some of your claims. So whoever works your claims and everything knows what your percentage of denial, can calculate what your percentage of denial is. So as you can see, like for 807 here, it's 5,914. Say I put 10% over here, that's going to reduce my Medicaid receipt to $5,323. It's going to reduce the amount of Medicaid receipt you have in your bud form because of the denials. It's a good way of trying to get as close as possible to what you expect to actually receive. Because even though, as I said before, even though you've calculated all the services and everything, we know you're not going to get paid the full amount. There's always denials. Always. Okay, here comes the big thing. Medicaid match. The percentage of denial will also reduce your Medicaid match amount as well too. But anyways, we have broken out Medicaid match into family planning, breast and cervical cancer, traditional preventive, K-CHIP, and expanded preventive. Family planning is only a match of 10%. Breast and cervical cancer and K-CHIP are a match of 21%. And traditional preventive is a match rate of 30%. Expanded preventive is 0% for the first 3 years. So we are trying to get your Medicaid match budgeted amount as close as possible. your family planning receipts will automatically feed in here from what you plan on receiving for family planning services. Your breast and cervical cancer receipts are the same thing. The traditional preventive is going to be whatever's left over once you do the K-CHIP and expanded preventive. So you all are going to have to figure out how much of your receipts is K-CHIP and how much is expanded preventive. I know there's been, whoever looks out on PSRS has seen these two new files. A PS Bill M dated 4/2/2014 and a PS Bill M dated 4/3/2014. We asked CDP to run these reports. We didn't know they were going to put them out there in everybody's folder, but that's okay. The one, it's PS Bill M dated 04/02/2014. Are all of your services for last fiscal year based upon the date it was entered into the system. So even if the service was done in June of 2012, but wasn't keyed in until July 2012, this would be in that. So they have taken those entered services by payer and have calculated what's family planning, what's breast and cervical cancer, what's traditional, and what's K-CHIP. You can use those reports as a guide to calculate your K-CHIP, as I said before, and you can see if it's in line with family planning, breast and cervical cancer. But K-CHIP can be taken out. Not everybody has K-CHIP. It's a very small program statewide compared to all the other Medicaid programs, but this will help you with the guide in calculating how much of your receipts is maybe K-CHIP. So that's a tool to use. PS Bill, you already have a PS Bill out there, but this one is a PS Bill M, and there's two of them. One's dated 4/2/2014, and that's for last fiscal year. The other one is dated 4/3/2014, and that is year to date this fiscal year through February, I believe. It may have been through March. I'll have to double check on that. It's through February. I wrote that down. I forgot I wrote that down. So use that to kind of do your K-CHIP. Now for expanded preventive, we haven't gotten all the numbers, but if you want assistance with this, we're coming up with a way to figure this out. I have gotten from Medicaid for each county how many Medicaid participants are in your county. I have gotten from CDP how many Medicaid participants, unduplicated counts, that you have in your health department. We're going to come up with a percentage of seeing of the Medicaid people in your county to how many you're seeing, a percentage, and then bump that up against a percentage that I don't have yet, that I'm waiting to get from Medicaid of the new enrollees for expanded Medicaid. We will be sending that out once we get all of those numbers, but it will help you with calculating your expanded preventive. That's, yes.
Now, once you put the expanded preventive in the yellow, will that subtract that from traditional?
Like, say K-CHIP is $5,000 and expanded preventive is $50,000. That traditional preventive reduced. So, yeah. So you wouldn't have to calculate traditional preventive. You just have to figure out K-CHIP and expanded, and the traditional will adjust accordingly. It's formula driven. And then over here, it calculates your Medicaid expense. And that will feed to the bed form. Yep. And that will go to $891 for your Medicaid match expense. The last tab on here is indirects. It is just show, this is just for, if you want to look at it, kind of like thing, but it shows how your indirects are spread to each one of the programs, whether it's clinic, medical, environmental, departmental, based upon the percentages, and it's driven by the direct salaries. Does anybody have any questions about the bud form? Does anybody have any questions about anything we've talked about today?
Now's the time to ask.
And as we said before, Vicki and I are always available. I highly suggest that if it's, a big question, you email it to us so that we can get to us, because as we said, there's 2 of us and 61 of you all. And so email, you're more than welcome to call, but email us if y'all want to, if you have any questions or if you have any technical problems.
Thank you, Ms. Freeman. Well, we thank you all for participating. I hope you all found this beneficial. There is an evaluation on train for the course, so we'd appreciate if you all would go back out there and complete that evaluation. If you think of ideas or other improvements in how we present our information, feel free to email myself, Melissa, or Vicki. We're all on Global because we want to make sure our training is beneficial. We don't want to take up your all's time and our time if we're not providing you all with information you're going to be able to use and make the improvements that you can get your budgets done more timely and accurately. So feel free to give us suggestions. We're open to that. And as Melissa said, anytime you have a question, feel free to call. It's what we're here for, not just during budget time. Anytime during the year, if you have a question, feel free to give us a call. Okay, thank you all. Have a safe trip back. Thanks, TV Land.
Good afternoon, North Central District Office. This is Lisa. How may I help you?